and you're all very much welcome. We appreciate your patience, and thank you for honoring this invitation for us to share and discuss how the project has been going on so far, what we've learned, what are some of the challenges that we've encountered, and possibly how we can move on in the implementation in a more successful manner. My name is Jim Chik from Unjong. I work at the West Africa Civil Society Institute in the Knowledge Management Unit. We are just going to do a quick round of introductions, after which we are going to look at the agenda very quickly, and then we move on to the discussions. In the meantime, our colleagues from Star Ghana will be joining us. They have an unforeseen challenge or encounter, but they'll be joining us in very, very soon. So we will just move on while hoping that they join us in the near future. So thank you all for following the ground rules which are on our screen currently. We encourage everyone to leave our microphones closed and only switch them on when we want to speak or we want to make an intervention. If we have any questions, kindly use the raise your hand icon and indicate, and the moderator, I will be calling you to share. If you lose your internet connection, feel free to go back to the email we shared with you, use the link to reconnect. And after this session, please kindly note that it is being recorded, and maybe just to find out, is there anyone who would not like this session to be recorded? If there is anyone, kindly let us know so that we take that into account, and we will endeavor to respect your wish or your decision. Without any notification on that, please, this session will be recorded, and we will share with you all the recording. And we also invite colleagues, once you finish your presentation, if you use PowerPoint, kindly put them in PDF format, share with us, so we share all the presentations with every participant in this session. I'll be moderating this session with my colleague, Charles Van Dyke, who will be introducing himself in a very short while. So very quickly, we are just going to we are going to introduce ourselves, and I'm going to use the list of attendees here, participants here. And when I just mention your name, kindly turn on your microphone and introduce yourself, just your name, your organization, and then we move on. If that's fine with us, I would like to invite Alfred Edufor. Please, Alfred, kindly introduce yourself.
Hello, good morning, everyone. My name is Participatory Edufor, Alfred. I'm a project officer in humanitarian services for Caritas Ghana. Hello, and a pleasure to meet you all.
Great, thank you very much, Alfred. Christian Elonge, please.
Hello, everyone. Here is Christian Elonge from WACSI, and it's a pleasure to be here with all of you and have a fruitful discussion. Thank you.
Thank you, Christian. Emmanuel Awine, please.
Good morning, everyone. My name is Emmanuel Anyarikia from Caritas Ghana. Thank you.
Great, thank you very much. I can see Ibrahim. Just one name. Ibrahim, please. Okay, if Ibrahim is not ready, please Kojo Owusu.
Good morning. My name is Kojo Owusu. I work with the Ghana Civil Society Organizations platform on the SDGs.
Thank you very much, Kojo. Lisa Emefa, please.
Good morning, everyone. My name is Lisa Sengrechi. I'm a program assistant with WACSI.
Thank you very much, Lisa. Next is Omolara Balogun, please.
Yeah, good morning, colleagues. My name is Omolara Balogun. I work with the West Africa Civil Society Institute as the head of policy influence and advocacy. I'm happy to be here.
Thank you very much. We are equally very happy to have you. I can see Precious. Precious, you have the floor.
Everyone. My name is Precious Ankuma, and I work with Pen Plus Bytes. I'm the project lead for the Star Ghana CRP project. Thank you.
Thank you very much, Precious. I can see someone signed in with Media Foundation for West Africa. Media Foundation for West Africa, please.
Hi, my name is Kwaku Krobi Asante. I'm a program associate with the Media Foundation for West Africa. I'm happy to be here.
Very happy to have you, sir. Reverend Sister Regina Ignatia, please.
Good morning, everyone. My name is Sister Regina Ignatia Afla. I'm the coordinator for Human Rights and Justice with Caritas Ghana. Happy to be here. I am here with my colleague, Sister Seraphine. Thank you.
Thank you very much, and happy to have you with us. Next is Samuel Zan, please. Samuel Zan Akologo. Okay, we will come back to him. Next is Stephen Amwajesi.
Hello.
Hello.
Stephen, kindly hold on, please. I think Zan had the floor. Please, Stephen, I'll come to you.
Yes, apologies. I forgot to unmute. My name is Samuel Zan Akologo. I am the team leader for Caritas Ghana. You already had some of my colleagues also connecting.
Thank you very much, Samuel. Stephen, please, you can take the floor.
Okay. Good morning, everyone. My name is Reverend Father Stephen Amwajesi. I work with the Archdiocese of Cape Coast, Caritas Ghana, Caritas Cape Coast, and I'm the coordinator of the FBOs in the Central Region. I'm happy to be here. Thanks.
Thank you very much. We hope to learn a lot from your experiences from that part of the country. Next is Whitney Segnona, please.
Okay, thank you. Good morning, everyone. My name is Whitney Segnona, and I work with WACSI. Thank you.
Thank you very much. Grace, can you please introduce yourself? Grace? Okay, Safia is in. Safia, can you please introduce yourself? I can see S. Musa. I guess it's Safia. I'm sure she's setting up. Is Ibrahim ready, please?
Yes, please. Good morning to everyone. My name is Ibrahim Kokugbadago. I work with WACSI as an office assistant. Thank you.
Thank you very much. Nancy?
Hello everyone and good morning. My name is Nancy Kankamkusi. I'm a program assistant with the Knowledge Management and Communication Unit of WACSI. Thank you.
Thank you very much, Shamri.
Good morning, everyone. My name is Shamrik Badonu, and I work with WACSI. Thank you.
Thank you very much. And last but not the least, Charles.
Good morning, everyone. My name is Charles Kojo Van Dyke, and I work at WACSI.
Okay, thank you. I hope we've heard from everyone. Marilyn?
Good morning, everyone. I am Marilyn Age, and I work with WACSI at the Knowledge Management Unit. Thank you.
Thank you very much. Safia, are you ready now, please? Let me see. Okay. Thank you all, colleagues, for that. Just to say, the organizations I heard include Pen Plus Bytes, Caritas Ghana, WACSI, Media Foundation for West Africa, and CSO SDGs platform. Did I miss any other organization? Great. Without wasting much time, I would just like to take a quick rundown of the program and basically the agenda. Of course, we know the goal for this session, that it's basically to help us to reflect. It's an opportunity for us to share our experiences and to enable us to learn, you know, identify the successes, what we can learn from others as we continue to implement this project to mitigate the impact of COVID in our country. And so we've done the introductions, and hopefully our colleagues from Star Ghana will share a quick message with us before we continue. Then after that, we are going to take a couple of presentations, one from Star Ghana, from Caritas Ghana, from the Ghana Federation of Disability Organizations, and from the Media Foundation of West Africa, after which we are going to have some questions and answers, if any. And then we'll take a quick break, just to stretch, take some tea. Then we come back for the third session, which is actually going to focus on the presentation from the Christian Health Association of Ghana, the SDG platform for CSOs in Ghana, Pen Plus Bytes, and WACSI. Then we are going to take some questions and answers. Then after that, we are going to have a discussion on how to communicate our results effectively. On that note, colleagues, I would just want to say that if you have a presentation that you want to make, kindly send a chat. So if you have a PowerPoint presentation, kindly send a chat on the chat section, so that my colleague, our colleagues in the communications team will write to you via chat and will note when you will be presenting, so that we can make you to be a co-host. That will enable you to be able to project your presentation. So if you have prepared your presentation in the form of a PowerPoint, kindly notify via chat and your name and your organization, so that my colleague will reach out to you via the chat to give you hosting rights, so that you can project your presentation when your time comes. On this note, dear colleagues, Safia, good morning and welcome. Okay, I think Safia is still settling down. Safia, can you hear me, please?
Sorry, Jim, maybe you have to ask her to unmute, or maybe she has not.
Thank you. Safia, please, if you can hear me, kindly unmute and share a word or two. Okay. I can see someone, Galaxy Tab A 2016. I don't know the name of the person, and maybe it could be Teiko. Okay. Dear colleagues, we are just going to continue. I would like to kindly invite my colleague Charles to do a quick opening of this, just to get us settling, to settle down, while Safia prepares to take the floor after that. Charles, please, you have the floor.
Thank you so much, Jim. So just to put why we are organizing this into context, so we are all part of a coordinated response to the pandemic, to the COVID pandemic in Ghana. And we are working in a coordinated manner. And we've been doing this since it was launched in April of this year. So it's a 5-month project. We are all aware of this. And we've come together to implement specific aspects of this project. And we are implementing based on our strengths as organizations. So just to give an overview of why we're doing this, it's because we want to complement the efforts of government to help to prevent the spread of the virus and to mitigate the effects on the people of Ghana. And so we've come together as 8 partners, right? FIDA, CSOs platform on SDGs, the Ghana Federation of Disability Organizations, Caritas Ghana, Christian Health Association of Ghana, West Africa Civil Society Institute, PEM Plus Bytes, and the Media Foundation for West Africa. And of course, we are all familiar with the various objectives. And just to go quickly through these objectives, the first objective is to do with information related to COVID-19. So there are a group of us in this partnership that are working on making sure citizens access accurate, timely, and relevant information. There's also another group that is also working on ensuring that we support vulnerable groups, ensuring that vulnerable groups and disadvantaged communities receive support, especially during this time of restrictions and social distancing protocols. Then there's also another group that is looking at issues related to holding the government accountable, ensuring the government is responsive and transparent with respect to the government's response to COVID, and also ensuring that there's the efficient and effective allocation and utilization of resources. Then there's another group that's looking at how do we ensure that all these things that we are doing, there's documentation and learning as we go along with our project preparation and implementation. So the reason we've organized this is that as a group, we don't have so many opportunities to come together. We've begun implementation, and now we are basically in August, and so we're getting to the end of basically this project. So we now want to come together to basically share what we have been able to do in terms of our actions, in terms of some of our outputs, our outcomes, and the partnerships that we've built along the way, the impact that we've already started seeing. But we also want to discuss the challenges that we have faced, and we also want to discuss opportunities for even more intimate coordination and collaboration. And then, of course, discuss how we make sure that the learning from this process actually comes out in a very clear and coherent way to guide our future interventions, but also to guide a response to a situation like this in the future. And so this is very important for documenting how we have contributed as both individual organizations, but also as a collaborative to respond to the pandemic. So we are very happy to host this with Star Ghana, and we are looking forward to colleagues sharing their experiences and also colleagues providing their perspectives and sharing feedback and strengthening each other's interventions so that as we move forward, we are even more effective. So you're warmly welcome, and I would like to encourage everyone to engage actively so that we can get the best out of this webinar. Well, thank you. Thanks, everyone. Thank you, Jim.
Thank you very much for that very settling overview of the project and why we are here specifically. We really do appreciate that. Safia, just a quick check-in with you. Can you please unmute your mic if you can hear me and introduce yourself to the group, please? Okay,
Hello.
Safia.
Good morning, everybody, and please pardon me for my unpardonable error this morning. I'm happy to join you finally, and I see that the House has just given an overview of the event. I wouldn't waste any more of our time. And Psycho sent her apology. Something critical came up, and she's rushed to BBC for a live discussion. So I'm sorry for joining late. I look forward to having a fruitful conversation this morning. From where I sit on the project, there's a lot I'm privy to, across the 8 partners. And I'm really, really happy about the progress we've made so far. In our discussions, what has always been clear is that sometimes we do not tell our stories as much as we should. So I am particularly happy that WACSI this morning and all of us would have this conversation to share our experiences and to be able to shape our next steps going forward. So I'm happy to be part of this. I wish us all a fruitful discussion this morning.
Thank you very much, Safia, for that. And we are very happy to have you here with us. So at this moment, we'll be taking the presentation from Caritas Ghana, from our colleague Zan. And while the presentation is being set up from our end, just give us a few minutes to set that up. I just want to implore us this is our platform. It is a safe space. It is for us to discuss, ask questions that will help us better understand, better appreciate the work of other colleagues. So feel free to note down your questions, feel free to note down recommendations, feel free to note down observations so that when we open the floor, we can all make suggestions that will help us to be better implementing partners, be it as independent organizations or as collaborative actors within this space. At this juncture, I would like to invite Zan. Please, your presentation has been projected. We hope everyone can see the screen. I can see it from where I am seated. I'll just do one quick check-in. I'll call randomly. Precious, can you see the screen, please? The projected screen. Precious?
Hi, Charles. Yes, I can see it.
Great. Thank you very much.
You're welcome.
Thank you for confirming.
Hello,
so
colleagues.
please,
Sorry. Yes, sorry. Except that is not the presentation. That's not the one. I sent a PowerPoint presentation.
Okay.
Since you can't find it. If you can't find, maybe I'll just speak.
No, we'll find it. Please, who did you send it to, please?
I have sent to Charles, I have sent to Safia, I have put it on the platform. I don't know. I've sent it to almost everybody. Can you see
Zan.
on WhatsApp by email?
If you've sent it, we'll find it. So no worries.
Okay. Please help.
Just
I'm
give
so
us
sorry.
1 minute.
Yeah.
We'll find it, yes. In fact, I found it.
Sorry about this. I'm in a different location and connecting on my smartphone, so I can't share screen, and I hadn't prepared my colleagues to do this.
No problem at all. We found it. It's about to be projected. So Chamrit, it's on your email.
Fantastic, fantastic. This is really appreciated. My apologies for this, you know.
Thank you very much, Zan. We appreciate. And for other colleagues who would want to project who have presentations in the form of a PowerPoint, kindly drop a chat on the Zoom chat platform, and my colleague Shamrit will reach out to you to get the presentation, or you can forward it to Charles Van Dyke, and we will project it for you when your time is due, please. Thank you. So in a moment, it will be projected. Your presentation will be projected, and you take the floor. There it goes. Thank you.
Ah, fantastic. That's the one. That's the one. Okay. And Mr. Moderator, may I proceed?
Please, you can, please.
Okay. Thank you really so much for this opportunity, but thank you more profoundly for even the technical support. Good morning, dear colleagues, dear sisters, dear brothers, and wonderful opportunity to share. I always say that knowledge sharing, knowledge management is an intrinsic part of the development work that we do. What my presentation here, I'm minded about the time that was allotted. So it's not going to focus on details of activities. I would just summarize them under three. So the Caritas Ghana intervention is actually doing so on behalf of the Interfaith Alliance, which is called the Faith in Ghana Alliance, made up of diverse faith-based organizations. I'm sure you're familiar with that, no detail, but just to say that this interfaith platform is made up of mainstream Muslim groups, Ahmadiyya Muslim Mission, Muslim Women's Association, then the various Christian groups of Pentecostal, Christian Council, Catholic, and other faith-based organizations. So basically, our intervention straddles three areas. One that is focusing on social and behavioral change, communication. How do you reach out to the population in a way that will trigger a change of behavior? And that basically means that reaching out to their hearts, to the things that influence their attitude, mindset, etc. The second dimension of our work is basically advocacy. Advocacy targeted at people who were vulnerable populations that were displaced because of COVID-19, mainly the Kaya, and there are other minor categories, but mainly the Kaya. So advocacy for resettlement and reintegration of these vulnerable persons. The third dimension is advocacy also, but we just isolated it so that we would be able to articulate the results and impact more clearly. And this is the participatory monitoring and evaluation. Next. And so as the template was provided, we now focus on, so what are the key achievements, or if you like, results, or, you know, outcome issues of the areas of intervention. So for the first area that I talked about, focusing on behavioral change communication. In this regard, we basically using religious leaders, men and women. And some of you may have seen that on social media, and there is a Google Drive link with all of those messages. So these religious leaders are speaking out to the population, either using social media or radio or video, etc. The result of this is that we have witnessed that a lot more faith-based organizations are joining, and we have seen the emir of the Ahmadiyya Muslim Mission, you know, talk about domestic violence. We've seen an archbishop, a Catholic archbishop speak. We've seen a general secretary of the Christian Council, speak. We've seen the spokesperson of the Office of the National Chief Imam. So all of this mobilizing voices and messages from people who would be able to raise these issues. As a result of this, one of the issues we are dealing with is non-compliance. People, the law is there, but people are not complying. But with the religious leaders addressing, speaking to the hearts of people, we notice that that is now increasing the use of face masks. And especially that they insist that you cannot come to their premises without it. So that alone is already a moral call. Then we have also seen improved adherence to social distancing in the places of worship, mosques, churches, everywhere. And another thing we are reporting here is that in our engagement, we are beginning to see a lot of the religious leaders say they are receiving more reports about issues of domestic violence that they are following up proactively. All of this happening because of the despair, the fear, and the psychological issues that people are facing from loss of jobs, or just, the psychology around all of this issue of COVID-19. And the whole issue of stigmatization. That is one central message that has been taken around by diverse religious leaders spanning from Muslim to various Christian group leaders, etc., etc. So, I mean, it's difficult to quantify this or early days yet, but it's important to point this as, outcome issues from the efforts that we are making, even if it is contributory rather than attribution. Because also we know that religious leaders are much trusted, and people tend to believe and take up the injunctions that are coming from religious leaders. On the second area where we are doing advocacy for the resettlement, we just want to put out two. First of all, this has increased high-level dialogue meetings with MMDAs in Northern region. And shortly next week, we are doing that in Ashanti. And they are really interested to see, they are asking the question, what can we do to help out? And we think this is very helpful. Now, in the meantime, already that is beginning to leverage some support to this KIA. Under the Star Ghana's support, we do not use Star Ghana funds for direct services. But at least through this advocacy, needs are emerging, and we are beginning to approach other people who are helping us, especially our own Bishops' Conference. Out of these needs have helped us a lot. The Vatican has helped us with a lot of, material support that we are targeting at these vulnerable groups. The same for CRS, etc. And we think that this is only possible because we have created the space for advocacy, platforms to articulate these critical issues, but even more importantly, platforms to enable these people directly affected speak out for themselves. Because in all of these dialogue meetings, the KIA themselves are sitting there, and we make sure we provide sufficient interpretation and translation that they are able to participate. The third area of participatory monitoring basically is process outcomes. We have been able to train citizens groups, mainly interfaith citizens monitoring groups, who understand the import of participatory monitoring and are using this framework to gather data. They are engaging 16 MMDAs across 8 political regions. That means 2 district assemblies per region. This is going to help us gather data about what the district assemblies are doing, MMDAs are doing in terms of implementing the social protection programs. And already we are, as I said earlier, the MMDAs, some of them are demonstrating serious commitment. Some of you may have seen that one of the GCs, I think that is Samiriku, posted on her personal wall after sitting in one of these meetings and actually made an open commitment of what she will do to support the Kayaye who are being voluntarily returned to Northern Ghana. Next week, she's coming to Kumasi to engage her counterparts. So we think that these are very interesting outcomes. Next, please. Next, please. Next slide, please. Yeah. So yes, no, that's fine. Leave the challenge of delayed disbursement. That's normally from Star Ghana. In terms of lessons learned, we are finding that the participatory monitoring tool and its approach is proving very effective in terms of collecting data in a very participatory approach, but also in a way of engaging policymakers. So in that way, we're building consensus on what to do about social problems. Next. And I'm coming to the end. In terms of opportunities, we think that direct engagement with state agencies and stakeholders to address known and emerging issues in COVID-19 is an important opportunity that we should see how we can maximize that, especially in the context where the government is beginning to roll out very clear policy frameworks. They are good, and some of you may have read my article. They may be good in themselves, but unless we follow through to implementation, they would just be nothing. They would just be theory. So we think this is an opportunity we must take up. Then the whole issue of provision of continuous support to vulnerable populations that could have been neglected. This is arising out of the advocacy platforms that we are creating, raising issues, giving opportunity to those affected to speak out. The third one that is not here that I didn't mention before the thank you is just to say that we see an opportunity for what I will call improving our application of artificial intelligence, basically ICT. And since WACSI is here, let me just say thank you for the learning we have had engaging with WACSI in the tech soup, in the capacity support that you have given to our staff. We are now beginning to apply that more effectively. I think that that's an opportunity from COVID-19 we should not let go. On that note, thank you very much, dear colleagues.
Thank you very, very much. Are you done, please?
Yes, I am done with it.
Thank you, thank you, thank you. We very much appreciate your respect for time. We didn't highlight that every speaker has 10 minutes, but you used 8 minutes, 30 seconds. That was apt of you, despite all the slight hitches. So thank you very much. Please, once again,
But to be fair, you did. It was on the program. The program communicates what you expect of us. Thank you.
Thank you very much. So, colleagues, if we have questions, if we have observations or remarks, kindly note them. We will open the floor for discussions shortly. Our colleague from Ghana Federation of Disability Organizations, is Christopher here, please? Christopher, please. Okay. I'm sure Christopher will be joining us shortly. Yes, our colleague from Media Foundation for West Africa. You have the floor, please. 10 minutes. Adiza? Hello? Please, who will be presenting for Media Foundation for West Africa, please? I'm looking at the list of participants. Okay. Hopefully, while Media Foundation for West Africa settles in, with your permission, I would like to invite Kojo of the SDG platform. Kojo, is it okay for you to present now? We can take your presentation, then we take questions.
Yes, give me a moment.
Okay. Do you have a PowerPoint, please?
Yes, I do.
So we need to make you to be a co-host.
Yeah, give me a moment.
Okay, you are a co-host. Thank you very much, Shamri. That was spot on. So you can project your PowerPoint. Yeah. Dr. James, please. Dr. James, are you there? Okay, Dr. James is not there. Christopher from Ghana Federation of Disability Organizations. Okay, not there yet. Adizatu Moro from Media Foundation. Okay, no problem. Then just checking it, I know Precious is here, and I know Nancy of WACSI is here to do their presentations. So yes, we can take.
Sorry, Jim. Sorry, Adiza is there. She unmutes, but it seems like we can't hear her at all. So I don't know. Yeah, I've seen her name, and she unmutes, but we can't hear her. So I don't know if, let's get Nancy to call her.
Okay.
Maybe she's having a challenge. All right, thank you.
Yeah, since Adiza is here. Or Adiza, you can send a chat. You can send a chat with the challenge you are experiencing on the chat platform, and we'll see it.
Hi.
Yes,
Jim.
please. Yes, please.
So, my name is Kwaku, also from Media Foundation for West Africa. Ideally, my colleague at Adiza Street will be leading the conversation, but it looks like she's having a challenge with her microphone. So I probably would start, and then when she's able to fix her microphone, she can join. Is that okay, please?
Okay, just give me a minute. Let me check with Kojo Owusu of the SDGs platform.
I'm here.
Yes, Kojo.
I went off a bit, but I just rejoined. But I'm ready to present, if that's okay with the team.
All right. So, Kweku, please, Kojo will present. Then after that, we will take the Media Foundation for West Africa, please.
All right, that's fine.
Thank you very much for your kind understanding. Please, Kojo, you have the floor. 10 minutes, please.
Okay. Please, can everyone see my screen?
I can see it.
Okay, good morning. So I'm presenting from the Ghana Civil Society Organizations platform on the SDGs. So our role on the project, we basically looked at two of the three objectives. The objective one being on how to support communities, NGOs, and citizen groups to develop and implement initiatives at the local and national levels. And objective one on how to increase transparency and responsiveness and accountability on the part of government and government agencies with respect to the COVID. The overall outcome from our end was to see how civil society organizations are coordinated and citizens have been engaged, and to know how effective government policies have been during this period. So in terms of actions and results, we basically set out to coordinate a local resource mobilization agenda support. And that helped, in that line, we had to establish, a civil society organizations COVID response fund, which is currently established. We, as part of that, we've been able to raise 119,702 cedis. We've had two main phases in terms of the actions on that fund. The phase one was done just around the lockdown era. The phase two, which we are at the moment implementing, has seen us with some procurement of face masks and IEC materials. We also, under that objective, were to facilitate the coordination of CSOs' efforts in fighting the COVID-19. So what we have done at the platform level is to organize a series of dialogues according to the various goals and various thematic areas. And between May and now, we've had not less than 4 dialogues and three major ones in May and 2 in June. We've had a couple of press releases, all on the theme of COVID, and then one position paper on the widening inequality as a result of COVID. We were also under activity objective 3 to, with respect to the transparency and accountability issues, organize some regional consultations. To abide by the social distancing rule, we've had to do most of that virtually. And so we've done 2 rounds of surveys. The first survey is done, which looked basically at the responsiveness of government and how people were in tune with the various policy measures. The current one, which is ongoing, is looking at how the impact of COVID measures from government. We've organized some media discussions which had the participation of the Ministry of Information. There's just some of the materials from the various actions that we have taken. The face masks, the IEC sticker materials. In terms of challenges, one of the things that we have found to be a major challenge, which probably will not be peculiar to us, has been the low penetration of the internet usage. In this era of virtual meetings and virtual engagement, we found that especially in rural areas where connectivity is low, it's a bit difficult getting feedback. And so for the 2 surveys that we have run, majority of the feedback have been from urban areas. One of the difficulties we've also found is that data on vulnerable groups are not so much disaggregated. So in a pandemic situation where you would need some specificity in locating and dealing with people who may be vulnerable, we find out that such data is not readily available. We also have found that in the era of a pandemic, a lot of, especially the national level civil society organizations are caught in a funding dilemma. Most funds are tied to projects, and to get permission to use them would require a lot of back and forth, which in a pandemic situation, 2 days, 3 days may be 2 days, 3 days loss of time could be detrimental to someone who may really need the support. We've also found that as a challenge that the normal civil society organization bureaucracy, and we use the term here bureaucracy with care. I mean, under normal circumstance, people have to tick boxes. If you make a request or you engage someone has to approve, it has to go here. We always, as civil society, want to do the right thing, ensure that we are abiding by all the best practices. We've realized that doing things under normal during a pandemic situation can be time consuming. So if to get something approved will take 1 week. In a pandemic situation, you're looking at how do we get that same thing approved within a day or 2 days. So doing the normal things within a pandemic situation is what we are at this point referring to as the bureaucracy back. In terms of lessons, we found that the local fundraising can be a very good alternative. And if possible, going forward, we should all see how that can be institutionalized. We do not want to project in what form that institutionalization may take, but from our experience doing the local fundraising, we realized that with the motivation and enthusiasm, it can be done. And so we should look at it and have a discussion as to how this can be institutionalized. We found virtual meetings to be effective in a way that it opens up the geographical reach. You set up a meeting, you set up a dialogue, and people from wide and near are able to join, although sometimes connectivity can be a hindrance. We also think that as civil society organizations, there may be the need to have more like an emergency plan of all the plans we make, so that in an emergency situation, we don't go back to doing things the normal and try to fast track it. So once we know this is an emergency situation, some of the bureaucracy can go off so that things can move fast. In terms of opportunities, I've already made mention of that under the fundraising. See how we can institutionalize local fundraising. We were pleasantly surprised at the numbers of people and organizations who were contributing to the fund that was set up, as low as 30 Ghana cedis to as high as 25,000 cedis. I mean, that was the range. And so for us, we think that there is a huge opportunity in that. There is also an opportunity for us as CSOs to also harmonize our data. If the government institutions are not able to give us such disaggregated data, I mean, every civil society organization works with some vulnerable groups in some corner at some place at some time. And so there should be that central unit where we are able to probably generate our own database to fall on in times of a pandemic. Thank you.
Thank you very, very much, Kojo. That was quite a succinct and a clear presentation. Very much appreciated. And once again, colleagues, if you need clarifications or want to find out something or share an observation, kindly note them. We will just take our colleagues from the Media Foundation for West Africa, and then a short presentation from Safia of Star Ghana, and then we take a short break. So, Kweku, please, Adiza. Sorry, Adiza, your microphone. You've notified us that it's not working. Thank you for sharing that with us. So, colleagues, let's kind of bear with them. Yes, please.
Hello.
Great. Thank you, Adiza. Good to have you on the floor. Please kindly introduce yourself, then you can move on. You have 10 minutes, please.
Thank you very much, Jim. My sincerest apologies for the bishop earlier on. My name is Adiza Tomorrow Maiga, and I work with the Media Foundation for West Africa. And then I am coordinating or leading the project on, together that Star Ghana Foundation is supporting us on. And our focus is basically on increasing the public's access to verified and factual information about COVID-19 through fact-checking and programming by media partners. So we all know that ever since COVID-19 broke, there's been the need for information, and then people are seizing this opportunity to put out anything and everything out there. this is really causing a lot of havoc among the public, as they are not able to distinguish between what is actually factual and what is fake. So for us at the Media Foundation for West Africa, what we seek to do on this project is to increase the public's access to this information. However, not just information, but making sure that the information reaching the public is verified and it is factual. We have been doing this since sometime April till now. And I can say what we do on this is, first of all, have a number of fact checkers. So we have employed these fact checkers who go through social media platforms, listen to audios by some key persons in society, and other viral information that is circulating on these social media platforms. What they do is they take this information, they do a thorough background check on it to make sure that the information that is out there for the public consumption is either factual or it is fake. And if it's whatever the findings, we put it out there. We also have a team of dedicated editors who go through this information. So it's not just the fact checkers doing the reports and then we putting it out there, but we also have a team, a dedicated team that go through every report that these fact checkers put out and make sure that it goes out without any flaw, without any mistake on it, and it is actually factual. We also share this information through our media partners. We currently have about 50 radio stations across the length and breadth of Ghana, at the national level, at the regional level, and even at the community-based level. We felt this approach was very, very important to make sure that every single individual in Ghana gets access to these factual and verified information. So it doesn't have to be that you have to be to have some kind of formal education to understand English, to be able to understand what is going on now. So with these community-based radio stations that we have partnered, they air the information in the various local languages, and even at the regional and even the national stations that we have partnered. We have made sure that the information that we put out there in terms of the fact check reports are disseminated in various languages to the beneficiary of every person in Ghana, because ultimately the information that we want to give out to the public is targeted to the vulnerable, which includes the semi-literate and then the illiterate. In terms of successes, we have been able to make some significant impact ever since we started this project. Gradually, we have noticed that the public is more aware, is more aware of the preponderance of fake news and misinformation about COVID-19. We have seen this in even individuals, citizens, the general public reaching out to us and saying that, oh, we have seen this on social media, we have seen that on social media. Is this something you can fact check for us? Our radio stations have also contacted us with these information, trying to get it fact-checked, and then they will also communicate to the public. So through this effort, we have seen that there's gradual acknowledgement of the existence of fake news, and people are becoming more aware of it, and they don't just take things at the face value and then begin to share. At least they pause and reflect and make sure that this information is actually credible, something that is worth sharing with others. We have also noticed that through this project that we are doing, there's been a lot of collaboration at the district level between the media and then government officials at the district levels. So our radio stations, for instance, when I say our radio station, I mean our partners. Our partners give enough airtime to the district authorities in terms of the health director, in terms of education director, per whatever discussion they want to discuss around the COVID-19. They give these platforms to them to further educate the people. Recently, we noticed that when we did a report regarding the stimulus support the government is giving to some small and medium enterprises, we did a report on that and shared among our partners. And then Shai Osudoku, for instance, and they did, held a forum where it gave opportunities to PWDs to air their frustrations about this whole support. And it followed up, we found out that the Shai Osudoku district and also the lower Manyakrobo districts were able to support these PWDs with self-sustaining items in terms of this pandemic. And we felt that this was a great effort, that through this collaboration, they've gotten some support. We've also made sure that platforms are given to PWDs, especially in the discussions, to air their issues, to express their concerns and any other information or any other concerns they have regarding COVID-19 and how government is addressing the issues, especially to support them. And a lot of interventions have gone on. Even the media stations themselves have taken initiatives to support some hard to reach communities. There are some communities as far back where you have to at least cross a river to get to those places. I've forgotten, but our radio station in Kano has been able to help by sending some PPEs to these communities, nose masks and all that. And interestingly, we have noticed that over time, because of the enhanced education, because of the education going on about these preventive and protocols that people have to adhere to, there's been some kind of employment or opportunities in this area. So one of our radio stations was talking about the fact that there's been a boom in the sale of face masks, especially the cloth masks. Now tailors and seamstresses are sewing these things on a huge and large base, and then people are buying. So they feel that through the education that they are giving to the public, people have been able to get the message and adhering to the protocols. Through our intervention too, there's been some interventions. For instance, in the Hohwe Municipal District, for instance, the official market days, which are Mondays and Fridays, have been cancelled, following the sensitization campaigns that have been going on the radio stations, letting people know that yes, the COVID is real and people have to take precautionary measures. Though they've cancelled these days and now the markets are free, people are able to go in and out any day, decongesting, especially on these official days as market days. There's been also the arrest of social media influencers spreading fake news. And the early days of our campaign, our fake news project, Joy FM did this report on a media influencer who was spreading fake news during the COVID, and this person has been arrested and prosecuted. So we felt that on a whole, this project has really impacted significantly the population. In terms of challenges, despite the successes that we have chalked or we have made on this project, we have noticed that recent happenings, especially around the elections, are marring the successes that we have chalked. We can see people going out to register. We are not saying that they should not go and register, but of course they have to adhere to the safety protocols that have been given out. But we have all seen that a lot of the time people are not adhering to this, making it more difficult for us to consolidate our gains on the project. We have also realized that with the electioneering activities going on, a lot of attention have been shifted, especially the media. The media is now divided on continuing educating the public about the fake news and around the COVID-19, and also discussing issues around the elections. So those have been the challenges that we are facing now. Lessons learned. We have noticed that implementing the project, there's nothing like we have to end. because COVID-19 has come to live with us, and we have to try to live with it. And as we continue to live with it, there are going to be issues of fake news still going on. So we have to have a continuous engagement with the media of such compelling content so that to enhance the education about the coronavirus. So basically, this is what the Media Foundation have been doing around the COVID-19. And we welcome any suggestions, any ideas to improve our work around the COVID-19. Thank you very much. Sorry, I don't know if my colleague, if I still have some time, and if my colleague have one or two things to chip in. I don't know if Kweku, you have one or two things to add.
All right, Kweku, 2 minutes, please. Thank you very much, Adiza.
Sure. Thanks so much, Adiza. I think that you have covered almost everything about the project. In terms of opportunities, we think that despite the modest gains and inroads that we have made with our work, we still have a lot of work to do that we think we can continue to improve. The COVID-19, the pandemic has proven itself to be very dynamic in the sense that at every point in time, information is evolving, it's changing, and for that matter, it gives us more work to do and more work to also reach out to people and partners, so that as and when there are any changes, we can also update the public to ensure that access to information is really achieved. Yes, thank you.
Great, thank you very much, and we are happy to know that you're open to embrace the challenge or the opportunity of doing more as presented by COVID-19 in order to keep all of us abreast and to have accurate information during this period. Thank you very much. I would just like to call on the last presenter for this session. Safia, please.
Okay, thank you. Good morning again, everybody. And I will apologize for coming in late.
Please, Safia, we are struggling to hear you. Maybe it's just me, but I don't know, maybe you can project your voice a little bit, please. Thank you.
Okay, thank you. Is it better?
Yes, better now.
All right. So thank you. My calendar shows an hour later for this meeting. It explains why I joined late. Forgive me, please. I just wanted to share a few things from our end at STAR Ghana, what we have observed so far. There are a few things we are also doing to support the direct implementation that the 8 partners are doing. We do not have exactly specific activities to do. Ours is more around coordination and also, sensing the needs and gaps as the projects continue, and then making efforts to fill them in to ensure that they work together very effectively. So far, what we have observed in terms of results, the results are what you are all mentioning for your specific project. And I just want to say that in the short span, for most of you from May to this point, a lot has been made, and we really have been pleasantly surprised. A lot has been made, and I think I have to say that we all deserve a lot of commendation for the commitment to the project. In terms of lessons for us at STAR Ghana, we have been faced with the requirement for us to redefine vulnerability. As we are aware, for this project, inclusion is key, and so ensuring that every single citizen benefits from the project one way or the other is critical. So how do you define who really deserves to be part of it? It's something that hits us. Under our gender equality and social inclusion call which ended recently. We did a lot of work around JESI, and we have our definition of vulnerability that we apply in Star Ghana. Under the project, we needed to relook at this very definition. For example, normally you would think of persons with disability, women, persons, there are those that come to you easily when you talk vulnerability and exclusion. For this project, we were faced with a new kind of vulnerability for different people. For example, CHAC, I'm not sure CHAC is on this call. CHAC, when they approached us and they identified health workers as a vulnerable group, initially it didn't hit us. We wondered why we should consider them, as vulnerable. But having implemented their project up to this point, we realized that we would have been making a huge mistake if we let that group of citizens out. So even in our strategy, we are really looking at our definition of vulnerability that we are working with. So that was one key lesson, that vulnerability is circumstantial. Is that the word? It's situational. And so we need to be flexible with that definition. Dan mentioned the thing around humanitarian support, and for them, they're balancing it with advocacy. That's another one that hits us. As a grant-making institution that has a certain framework and locus to work within, a humanitarian crisis hits. And normally you are looking at advocacy, you are looking at active citizenship, ensuring that government does its bit and not taking the space and beginning to provide service delivery. But this was different. This was humanitarian crisis. You cannot go to Kayaye that have been displaced, thinking about food and butter, and then you go wanting to talk to them about engaging the state about their rights and stuff like that. So it required that we were a bit more flexible again on what we could fund and what we couldn't. There have been some difficulties, but at least during the lockdown, between us and Caritas, there was a little flexibility to look at that. We have told ourselves that we need to begin to engage donors to be more realistic and practical about some of the demands, Then the thing around generally our civil society work, which for some time now puts humanitarian support on the low, because generally our record in terms of humanitarian crisis of the country has improved over the past decade. So for a lot of civil society organizations, it's almost totally out of the radar. It's advocacy based, but this one came and we needed to do something. Perhaps the lesson is that whatever our strategies, whatever our focus, humanitarian response will also need to be given a bit of attention somewhere, so that when crisis hits, we are not caught hands down. We see that under this project, and I think the civil society response to COVID-19 in general, the media is a huge partner that we shouldn't underrate. Currently, we are battling with the issue around visibility, and with the fact that either deliberately or not, government doesn't seem to acknowledge civil society support so far, and it takes the media sometimes to get this happening. But also to even get citizens to know that there are these opportunities at Media Foundation for West Africa, WACSI, Caritas, for all of our partners, for them to be able to access those services and also improve our advocacy drive. So for me, I find a huge opportunity within the media to do a lot more. And maybe we can discuss this later, that even within this partnership, we have the resource within Media Foundation for West Africa to make use of our media houses that we have partnerships with across Ghana. So far, I'm not sure we have done very well utilizing them. So we may want to discuss how we can take advantage of them to help give our projects the boost that it deserves. And then another opportunity that we need to tap, and I think somebody already mentioned it, is the collaboration with other stakeholders for us to get the best of outcomes. So with the state, there's still a gap. I see us making efforts now to close that gap, but also with the private sector and other stakeholders, we need to begin to engage that. I don't fault us so much that we are currently where we are. We have taken 3 months to understand the situation, to offer what we have to offer. And so at this time, we have learned a few things as we are discussing. and we need to begin to engage other stakeholders to see how together we can bring the best of support to, you know, mitigating the impact of COVID-19 in Ghana. So that's an opportunity we would want to tap. For us at Star Ghana, our role within this project is that once in discussion with all of you, we identify these challenges, lessons, or opportunities. Again, we see how we make them reflect in the way we implement the project. So I'm looking forward to how we all conclude on what we should take forward. In terms of challenges, I want to highlight data. Data has always been an issue, but I think even under this project, it's a bigger issue. There's a lot to talk about, but often we lack the numbers, the statistics to support it. You know, so we say that domestic violence has increased. We don't have the figures. We cannot fault ourselves much, but we need to be able to discuss how we can maneuver these challenges. You know, it's difficult to convince anybody that the cases have increased when we do not have the statistics to support it. And in talking about data, for me, as I read reports and many things, that is also what is missing, that there's a lot happening, but the data to support the numbers we are truly reaching, to support the actions we are actually, you know, we are really taking on the ground, who is involved and all of that. Sometimes that data is not, it doesn't come out as strongly as it should. Then the second challenge I would want to mention is administrative. Some of you have already mentioned some of them. You know, we get tired. No, we shouldn't get tired of complaints around funds delays, but especially for this project, we know that this is an issue that should never have been. But again, from where we are, there have been some real challenges maneuvering this administrative issue. You have donor requirements to meet, but you also have an emergency situation to be smart to respond to. So how do you balance it? Sometimes it puts all of us in really difficult situations. And I'm not sure we can have all the answers here, but I just wanted us to be aware that we recognize the challenges that partners face when our administrative and bureaucratic procedures become stumbling blocks, and that we are willing to work with any suggestions that might come up. So far, these are the lessons and opportunities, and then the challenges that I have observed. As I mentioned, in terms of results, there's a lot coming from all of the 8 projects, and putting it together, it gives a really good picture. 2 weeks ago, when I prepared the quarterly report for the project, colleagues and everybody that read it was shocked that this much happened in such a short time. And so I was sharing with my colleagues that perhaps the lesson is it a lesson, but I am learning that the longer organizations or projects have to deliver on outcomes, then it looks like it takes a much longer time to settle and begin to deliver. For our Star Ghana program, the strategic project that usually would have 2 to 3 years plan, you go for monitoring first quarter, and things are still at the preparatory stage. We are setting up structures and all of that. Second quarter, not much to deliver. But this one, an emergency one, in 3 months, we have given up so much. So perhaps pressure makes us, you know, give it all out. That's one thing I observed also. But just to say that congratulations, I think we are doing so well. We just need to talk more and pull out the lessons and plan the way forward much more practically. Thank you for now. I have lots of questions for the presentation so far when we engage. Thank you.
Thank you very much, Safia. Very much appreciated. So colleagues, the floor is open now. Chris, thank you for joining. You will be presenting in the next session. So please, colleagues, the floor is open. If you have any questions, if you have any observations, kindly show or raise your hand, and we can take them one after the other. You can go by a show of hand, or you just drop a note in the chat. I have a question, I have an observation or a remark, and then we'll take them one after the other. Okay. Great. I can't see any hands raised for now. So
my hand is up.
Yes, Safia. I can see Safia, I can see Zan. So I will take Zan, then Safia, please. So Zan, you have the floor.
Okay, thank you for the opportunity. My question goes to Safia or maybe Star Ghana. They have a facilitating role. I really have been struggling with how they can help us to bridge the gap between advocacy and service delivery, especially in this context of the pandemic. And I'm happy that she raised it, we raised it. My colleague Kojo also raised it. You know, we're used to doing our advocacy, but in this situation, the practical needs are staring us in the face. Star Ghana current funding regime is not for humanitarian services, but at least can they facilitate that they are able to provide linkages to other organizations that might be able to address these practical needs? Do they see a role for them in this regard? I'm just asking a question.
Thank you very much. Very useful question, Zan, and that's noted. Safia, you have the floor, please.
Hello, Zan. You and I have gone on this conversation a number of times. It's quite a difficult one, you know, when you know that there are real needs that need to be met, and yet you're really tight in how much you can do. At least on this project, because we haven't been able to meet that angle of essential service delivery, we have tried to be a little, some flexibility was introduced, at least for the task when there was a lockdown. With you, Caritas, I know that during the lockdown for Kayaye and other displaced persons at Padama, you were able to give them some tokens to support their upkeep. It's totally out of what we normally would be able to do. I know that we wanted to do more after the lockdown, but by then our donors come their feet and said, no way, what we did was okay. With CHAC as well, we procured a lot of COVID commodities to be used at health centers. We also trained lots of health workers. These are usually out of our areas of work. It was permitted because of the current situation. So at least just to say that there has been a little flexibility. We wish we could do more, but currently this is who we are, Star Ghana Foundation, with funding from UK Aid and the European Union. They have specified that we need to use it for this, and that to build an active Ghanaian citizenry. We cannot use it for this. And so for the current arrangement, we are totally tight. Asking about what we can facilitate to make it easier. To tell me the truth, Dan, we may not have discussed it with you, but on our own as the organization, we have made some contacts. We've reached out to some institutions and groups that we hope would sort of complement what we are all doing to be able to provide that other angle of service delivery. We have been somewhat very successful. The thing, when you are known, you know, that identity and brand, when you are known for a certain area of work, it gets difficult sometimes when you want to sort of branch or bring in new dimensions. So unfortunately, it's been difficult, but I'm just saying, I'm assuring you that this is something we know that we should be able to facilitate, and so we haven't put it off at all. We I just would commend you, Zan. I think for you at Caritas, you've done great. You've done really great with mobilizing services for persons from foreign countries and all of that. You've done great. Also, identity as a faith institution has helped. A lot of us do not have that benefit, and so it's a bit difficult. I know I'm not answering you the way I should, but this is the situation. And if you would permit me, Jamie, to continue with my question.
Yes, please, you can.
All right. So Zan, the first one is actually to you. I think your second but last slide talked about the fact that certain issues have been identified and that we need to begin to engage stakeholders on those issues. That was how it was stated. I had missed some parts of your presentation. So I'm not sure what issues you have identified and so that we know which stakeholders should we be engaging. In that, so going forward, as we have our stakeholder dialogues and other engagements, we are really targeted in who we bring on board. I would like to hear that, Dan. I have questions for Kweku and Adiza as well. Should I go on?
Please, you can ask all your questions, please.
Okay. So, Kweku, the SDG platform is really huge. It covers most CSOs across Ghana. I'm wondering how you have used that resource, that huge resource, to be able to reach the, to increase the reach that benefits from this project. For the survey you discussed, I feel that a lot more could have been reached than it is. And so sometimes when we quote it and then the results we take from it, the sample size sort of hits us and it doesn't make the kind of impact we want. Are we not able to use that space that we have to reach more? Also, having put out the survey report, at least for the first one, what is your plan around engaging the issues further with the stakeholders that need to be targeted? For you, Adiza, at the local media radio stations, a lot of discussions have been happening across Ghana, and that's really a huge volume of conversations going on. I believe that there are salient issues that come up. I'm wondering how you connect that to the national discussions. You have a few national radio stations as well. How do you connect the local with the national? I'll be happy to hear that. Thank you.
Hi, Safia. Hello.
Yeah, who is that, please?
This is Kwaku Media Foundation. Safia, could you kindly repeat your question? At some point, your voice was being drowned. I think it's the internet.
Okay, I asked how you link local level conversations with the national so that discussions, far away from Accra do not just end there, that they are able to make their way into setting the national agenda and getting some responses. Is it clearer?
Yeah, it is.
All right, so thank you very much, Safia. So maybe I'll just begin with Adiza, then from Adiza to Kojo, then from Kojo to Zan. Is that okay? So Adija and Kweku, if you can take 1 minute to respond, that would be helpful. You have the floor, please.
Okay, so I guess I can quickly respond to how we are connecting things happening at the local level, or at the national level also. What we have done, and it is not only peculiar to just this project, but what we have always done as part of our local governance project is to try to empower the local communities in terms of, the local radio stations. We know that they don't really have the resources to engage at the national level. So what we often do sometimes is to partner to kind of give a mentor to these local radio stations. So maybe a journalist at a local radio station may have cited something that he or she wants to work on. It can be a documentary, it can be a report, a feature, or something like that. So we also find somebody at the national level, maybe Joy FM, to guide the person to produce such a great report. And then we'll use our opportunity, the platform we have at the national level, to amplify these maybe documentary, if it is. We did that for the testy dams, for instance. So somebody at a local level does it and is assisted by somebody that we recommended to help, and then it was taken at a national level. And we have done this also during this COVID-19. Currently, the people of Domiabra have this belief that COVID is only prevalent in the cities. And so once this was made known to us, we connected our local radio station with Joy FM to do a report on it, to amplify this. So we realized that it is not even at that level alone, but it is something that is of national interest, because we had people coming in to comment about it, that yes, it is true. It is not only the people of Domiabra, even in Accra here. And Joy FM has also gone ahead to do some reports within Accra to show that it is not peculiar to a village or a community very far away from Accra, but even at the national level, we have this. So every now and then we collaborate with these local radio stations. Wherever their resources, they are not able to use their resources extensively, we get the national to partner them, and then we use the national platform to amplify these issues. So that is what we have been doing, Safia, if maybe I'm able to respond to that on that. That is what we have been doing.
Okay, thank you very much, Adiza. Kweku, did you want to add something? I can see your mic on.
Yes. I think that Adiza has substantively dealt with the issue. I probably will just add a little, just in that accordance. When we started this whole project, I think we employed some of the journalists we employed were scattered across all over Ghana. A case in point, there's a journalist somewhere in Ahafo. When the COVID-19 case started, we started recording the cases, for the other places beside Accra and Kumasi. So during the time at the Ahafo region, there were rumors here and there that a man has tested. So this journalist reached out to us that this is what is happening there, and he wants to go to fact check it, to indeed verify if that's the case. We provided him the guidance to do that. He presented the report. We thought it was great. We helped shape it and then put it out there, just to defray the fears and all that indeed at that time they hadn't recorded any case, and for that matter, people could have that truth or that fact that to guide their way and to influence conversation at the time. So essentially, just tying into what Adiza is saying, we have been using all those conversations around supposed hinterlands or the places that are quite distant from Accra, so that when we get a report, we help push it out here, push it on social media to stem the conversations, to influence the discussions that is ongoing.
Okay, thank you very much for that. Zan, please. There was a question for you.
Yes, that's correct. Safia wanted to know the details about what issues are we talking about. Let me just focus on 3 dimensions within 1 minute. Hello, Safia out there. For example, that the messaging by our respected religious leaders has focused on avoiding stigmatization, avoiding domestic violence, assuaging fears and panic, but also, demystifying the untruths. that are being peddled. And that is where the connection with Media Foundation is helpful. So this approach, quite honestly, has been a big shift when we engage with the MMDAs. When this whole thing started, the whole response was about, it was seen as a clinical treatment. How do you provide PPE so that you prevent it? Then how do you test? And things like that. The other dimension, softer impact or effect of COVID-19, which is the psychological dimensions, were not receiving that attention. Today, because the religious leaders have emphasized consistently these issues, is beginning to get attention. That's one example. The other example is in our dialogue meetings, and I'm happy that Reverend Father Stephen Amwajesi from Cape Coast Central Region is still on the call. He can testify. I attended his last dialogue meeting with the MMDAs and other stakeholders, media, NGO partners, and other sectors of government, NCCE, social welfare, I don't know who else was there. And the testimony was that this was the first time that all the stakeholders were sitting around the table and talking about what they can do and complement each other on COVID-19. The downside of it was that I left the meeting, everybody appealing to Father Amwajesi, and I hope Father Stephen is still on the call, to assure them that he will be doing this on a regular basis. Can you imagine that? This should rather be facilitated by government agencies. So that stakeholder collaboration, engagement in practice, it's one of the issues that is being picked up. And, so I could go on with such concrete examples. And of course, we already have talked about the concrete needs of addressing vulnerabilities, how that has become an issue. How do we deal with it in a complementary fashion? These are issues that we are discussing and as I said, next week, some of the MMDAs in Northern region are coming to meet colleagues in Ashanti region, and we look at how they can collaborate to facilitate this resettlement, this reintegration issue. So these are the kind of issues. I could talk about other minor issues coming up, and of course my colleague David is not on this call because he's on another meeting, but we could tell you real concrete issues that are coming up. But it depends on the context, So it's not as if there are some that are cross-board, as I have mentioned, issue of addressing other dimensions of the impact of COVID-19, especially the psychosocial dimension. The issue of stakeholder collaboration in practice is gaining consideration, but also a discourse, a conversation around complementary approaches to supporting vulnerabilities is one of the issues that is on the table for discussion. Yeah, that's it.
Yeah, thank you very, very much for your response. Kojo, please.
Thank you, Jim, and also thank you, Safia. I think the question on how we take advantage of the reach of the platform, especially in the assessment of government policies, is one that myself and my co-chairs have been discussing and debating ever since the beginning of the project. If I say I have more like a customized answer as to why we had the numbers we had, I would be second guessing and probably just trying to play on Safia's intelligence. But from a researcher's point of view, personally, I can say that, to conduct a research or a survey and get the numbers in the thousands or in the 10,000s require a bit more time a bit more planning. But in the current scenario, we were caught in a situation where we needed to jump into it and get things running. And so a lot of the what you would do in a full research preparatory stage, we had to fast track, and to a large extent that may have come back to harm us. Some of the feedback I have received from some of our members who I have engaged directly to help us in sharing the survey and in pushing it down across their networks have been issues around bureaucracy. So if, for instance, I just, as an example, if I was to have shared this with Jim and said, Jim, can you share this with people within the WACSI network? Jim would need to cross-check this with his boss and get approval. And to a large extent, the internal institutional bureaucracies come back to haunt us. So it delays the time that they would have disbursed or shared. We were about rounding up so we can make some initial analysis. So it's one of the things that have really been a challenge for us to address within the short time span we had. One of the things that I have also been told is that probably up until COVID, a lot of the platform's activities had not been virtual. It's been more of physical engagement, meetings are physical, discussions are physical. And so the wisdom in doing that was that a lot more of the members in the rural areas outside of Accra are more prefer, or they prefer to have these meetings in person, or these engagements or these activities in person because of connectivity issues. And so for a lot of the engagement to have even been happening virtually, the dialogues, the meetings, the discussions, it seems to have been to a lot more people was a new shift, and a lot more of our members are now getting used to this whole virtual engagement. So to answer that question, I think that time really was our major constraint. If this was under normal circumstance and you needed to do a full-blown research, a full-blown survey, and have the numbers, then you could have at least a minimum 3 months. Some surveys take a longer time to even prepare before you hit the ground running. So I think that would be my attempted response to Safia's question.
Thank you very much, Kojo, and thank you all very much, colleagues, for your presentations. Just to say, it's really been a very enlightening session for us. And I think, Kojo, in your presentation, you flagged something, the emergency plan. How are we as organizations reflecting around that? Have we even factored that in our work today and for tomorrow as a lesson that we are learning from the incidents of COVID-19? And I think that's something that as partners we should reflect on for the future, and hopefully we will reach out to you to have a further discussion around this. One key thing, and I think Safia raised that very sharply around data. Data has been an issue. Data is an issue. Even Kojo's last response still highlighted the fact that even when we have the will, the means, and the aptitude to collect data, there are certain factors that are likely to prevent us from gathering the data we need to do our work. So it's really important that we find ways to collect this data, and within the scope of this project, it's even important that, particularly because these are our last weeks in the project, and we'll be submitting our final reports very soon, as much as possible, we should bring in volumes of data. figures, statistics, numbers will really be helpful in the process and even be a source of reliable information post this project. I remember Teiko and Charles were on TV3 yesterday, and one of the questions that was raised to Teiko was, how many people have we been able to reach out to impact with this project, you know, and that was a really important question. And even as we have plans to engage with the media and other stakeholders in the weeks ahead, it is important to have this question at the back of our minds, collate the data. When we are submitting our reports to STAR, we should share that, because even from our end at WACSI, we will equally fall back on the statistics, you know, on the number of people we are able to reach out to. For example, Media Foundation for West Africa, how many facts have we corrected or rectified, you know, in terms of misinformation in the public space, because those numbers will really be helpful in helping us to better put forward our story. So thank you very much, colleagues. We wouldn't drag this session any longer. We will be taking a short break, and when we come back, we are going to be taking the Ghana Federation for Disability Organizations. We have a representative from CHAG with us. We have Pen Plus Bytes, and we have WACSI. Thank you all for your patience. We are going to take a short break of 5 minutes. Feel free, take some water, stretch out, relax yourselves, and in exactly 5 minutes, we will be resuming phase 2 of these discussions, if that is fine with everyone. Thank you very much. And just to add that part will be moderated by my colleague Charles. So we can go for a short break, 5 minutes, please. And when we come back, my colleague Charles will take the floor. And we will begin with the Ghana Federation for Disability Organizations. Thank you. Thank you. Thank you very much, Shamrit, for that wonderful, relaxing tune. It made me to feel like I am in Eburi Gardens. That was quite wonderful of you. Dear colleagues, we will be continuing, and like I said, in this session, we are going to begin with the Ghana Federation of Disability Organizations, then CHAG, then Pen Plus Bytes, and then WACSI. And to facilitate our discussions, I would like to invite my colleague Charles Van Dyke to guide us and moderate this session. Charles, you have the floor.
Thank you so much, Jim. Really thankful, and thank you so much for all the presenters so far. Very insightful, and I've learned a lot, and I'm sure colleagues are also learning a lot. And so, like Jim mentioned, we're going to start with the Ghana Federation of Disability Organizations. And I believe our colleague Christopher is ready for the presentation. Christopher, please, you have 10 minutes. Hello, Christopher, we can't hear you. I've seen that you have unmuted, but you may be having an issue with your sound. Hello, Christopher. We are still struggling to hear you. Okay, I think I'll have one of my colleagues get in touch and see what the challenge is over there. I think he has an issue with the sound. Do we have a representative from the Christian Health Association of Ghana, please? From CHAG, Christian Health Association of Ghana. Anybody on the call? Anybody from CHAG, please? Okay. Okay, so let's move on. If I could indulge our colleague from Pen Plus Bytes, Precious, if you are ready to make your presentation, please. Hello, Precious. I think you're still muted. By the way, let me confirm, is everybody hearing me?
Yes, Charles. I can hear you. I can hear you very well.
Oh, okay.
I can hear you.
I was wondering. So Precious.
Yes, hello, Charles.
Okay, welcome. So maybe
Thank
you can go ahead. Apologies. I know you're supposed to be third, but maybe you can start, then our colleagues will join in.
Okay.
So please go ahead, yes.
So I can share my screen, I suppose.
Yes, please, go ahead.
Okay. Hello, good afternoon to everybody on here. I'm trying to start my share. Okay. Okay, so I will speak to it, and once I am able to share my screen, everybody can have a better view of what I want to share. Pen Plus Bytes started off with this project with a focus of increasing and improving on citizens' access to accurate, timely, and inclusive and relevant information on COVID-19 and government's response actions towards the pandemic. We had two main activities to work on, which was to deploy an online platform and also to curate regular blogs on COVID-19, as well as government responses and plans. What we set out to do was to target the gaps in communicating on COVID-19 protocols, as well as government responses that we had identified in the communication gaps, I mean. And so we realized that for illiterate and semi-illiterate Ghanaians, they were left out of the loop. Young persons also had varied information sources. Persons with disability, with particular focus on the visually impaired and the deaf, were also part of our target groups. So what actions did we set out to do? We have so far built and we continue to manage an online platform with a website address www.covid19infogh.org. Now, this platform is like a repository of COVID-19 news stories we have gathered from all over Ghana. And these are original stories we have from our 18 regional stringers in all the regions of the country. So we have 16 regions, but we set out with 18 stringers because we focused, we thought that Accra and Kumasi, being the epicenters for this pandemic, would be right to have 2 stringers in those regions, which makes up for the 18 regional stringers we have. And so the platform ideally has 2 functions. The first is that it's a rallying point for citizens' feedback on government's response actions. So we did prior research on what government has done so far in response to the pandemic, and we identified thematic areas in the area of health, professionals, who are the frontline workers. We also found the water and electricity rebates that government gave, the business stimulus package that government also gave, and then the procurement of more PPEs as well. So these were thematic areas we set out to find citizens' feedback, or persons who were involved with these thematic areas, their feedback on how well government was doing or otherwise. And what we did with the platform was that we had a crawler of a sort on Twitter. We wanted to add on Facebook and WhatsApp because we thought that a lot more Ghanaians are present on Facebook. But the bureaucratic process of going through Facebook permission to get a bot to run through their comments and likes was quite lengthy, and so we had to let go of it at a point and just concentrate on Twitter, which was, at the time we built the site, it was free. So we have a bot that is running on Twitter, and what the bot does is that it has been fed with keywords, and so it gathers tweets and retweets around these keywords, which are related to the thematic areas I have mentioned earlier. And what it does is that it's able to segment the comments based on these thematic areas automatically. And we also consulted with our partner, the CSO platform on SDGs, and they gave us the raw data and the raw questionnaires they had given to people to answer for their survey, and that's we put on the poll system. And so we had people coming through to answer that as a form of collating their feedback. So the platform primarily, like I mentioned, is the rallying point for this feedback and also an information sharing platform. We also recruited a group of persons we call social media animators. So once we develop information materials like infographics, motion graphics, and videos, we send it out to these persons who are like influencers on social media. So theirs is to share it among their constituents or their followers, and then they engage them, they amplify the content to get what people think about the content they have shared, and these are reported monthly to us. So they have a coordinator who gathers their reports and puts it together. We are able to get the number of persons they have reached via the content shared, and then we get the responses or the feedback that people sent through with that report as well. We also set up an editorial board. Now, the editorial board is not the ordinary editorial boards we find in newsrooms. So what this editorial board does is that it serves as an advisory team. Every month they meet twice. Their first meeting is when they come up with story ideas. So they look out for angles that are not being explored. What are the untold stories around COVID-19 that people are not hearing about? Which angles can we pursue looking forward? And then we put these together and we call it story ideas for the month and share it with our regional stringers. Their second meeting then is to come up with 5 of the best stories that have come through. So once the stories are brought to us, we have an in-house editor who edits it, and then we send it to the editorial board, who then decides that these 5 we think have a potential for wider reach, and so we should make them into podcasts. And then we give it to our podcast host, who then does the podcast series, and then we get the raw format of this podcast. We send it to our contacts who are like our community radio stations. That I would want to commend Media Foundation for West Africa for helping us with that. And so these contacts get these stories, and then they translate it into their local languages and air them on their radio stations. So it's a coordinated effort between the regional stringers. So it starts from the editorial board, then to the regional stringers, then to the podcast team, and then to our community radio stations. And all these are aimed at increasing relevant information and improving on the kind of COVID information that is out there at the moment. So what are the results we have collated so far? We have, as at the 25th of July, we have over 200,000 visitors to the platform. So the platform was launched on the 25th of June. And so on the 25th of July, we decided to assess what we have done so far, which is like a month from the time we launched. We went public with the platform. And we realized that we have a little over 200 visitors who are, most of them are one-off visitors. So they come and they check, they look, they go through the tabs on the platform, but what we didn't get was enough respondents to the survey or the feedback poll system that we had left on the platform. So we had only over 100 respondents to the survey. So we sent out the responses we had from that survey to the CSO platform, and we did a bit of analysis on it, and then we sent it to them to add on to their survey results. We also got about 5,000 direct tweets on COVID-19 issues, which were tracked, and then we segmented it under the thematic areas and interventions. We will say that from our keyhole analysis, we realized that about 2 million persons were reached with content on social media. These were impressions that were made from our social media animators on the content that was shared. I think I drew the attention of Star Ghana to the fact that we mentioned them in every content we distribute on social media, but they had a challenge with their handle, and so I'm sure by now they would have rectified that, and we are good to go, and they can check on their social media handles to see what is going on in on that front. For the original stories, I would say that journalists have gone all the way out with the story angles that have been shared. So the last stories we collated, we got stories about how persons living with persons with disabilities are coping during this pandemic. So we know that the virus spreads when you are in contact with people, you hug them, you move them out, you touch them, you touch surfaces that have been touched by the infected persons. So for a person with disability who needs an aid, for instance, how are they coping during this pandemic? Does a person have to wear a glove, for instance, to carry whoever needs to be aided around? Does a person need to disinfect his body, for instance, to get the person who needs to be aided around. And so this story, I would say that has been one true impactful story in the other communities where we have shared it. Now, what are the challenges we have identified so far? A few persons, I think Kwejo mentioned the timing problem. With building an interactive site, we think it through and have several iterations. When I say an iteration, it's a test run of the site to get people's comments about it and how resourceful or how user-friendly the site can be from those responses. But with this particular project, we didn't have the luxury of time to go through all the iterations we would have normally done with an interactive site. And so it's on the go iteration, let me put it that way. So what we have done is that once we get anybody's comment about how the site is working or how the site feels now, we try to work around it and get it to work better. And that has been challenging. It will mean that you have to work around the clock with the programmer to get things done. And because we don't have much time to do that, that is a big challenge. For our regional stringers too, we realize that the challenge of time is really affecting them because for a very good story to be done, you need multiple sources. But if you have 1 week to deliver a story, and for instance, your source says that, oh, this week I am unavailable, can you come next week? That is a challenge for you as a journalist because then you are working against a deadline that you cannot meet. And that has been a back and forth I'm having with my journalist. But all in all, we are trying to work around it and see how best we can manage this. One other challenge is the challenge of apathy. So with apathy, we realize that in recent times, citizens are a bit in denial about the existence of COVID-19 generally, because everybody thinks, well, if you are asymptomatic, it means that you cannot really you can't really share the virus as has been reported elsewhere. We think that this has really affected our outputs because then people are wondering, why would I go to your site in the first place to leave a comment? This is a big challenge for us in garnering citizen support. Then also the challenge of apathy on the part of the reporters. I remember one partner mentioning that I think Adiza mentioned it, that there are competing issues, particularly around this time when campaigning for elections 2020 is rife. You realize that to get a journalist who is actually working within a media organization to go out of his way to do your story when there is a trending issue on all other platforms about a political figure is a big challenge for us, because then you would have to try to convince this journalist why you think it's important for him or her to do your story and leave behind what his media organization is asking him to do. And there's also this challenge of the reporters thinking that, well, the stories have been told over and over again. So the stories are getting kind of stale. So what new thing can we say that hasn't been heard before? Then there's the other challenge about segmenting feedback from users, particularly with vulnerable groups and then the PWDs. With the analytics that we have, we are unable to tell how many users are persons with disabilities. So a proper segmentation would then have to tell us these number of males are persons with disability, or these number of females are persons with disabilities. And that challenge is a technological challenge, let me put it that way. We are still thinking through how best we can make that work. But at the moment, that is a challenge for us. So what are the lessons and opportunities? We think that for a short span project like this one, there should be a longer span period for planning. so that when you set off with implementation, it wouldn't be a huge barrier for you, but you can easily get on with what you seek to achieve. We also think that if we want to coordinate the efforts of all the CSOs partners under this project, it would have been prudent to use one platform, which will then serve as a repository for the information and media materials from all the partners being used, or being a reference point for all these results that are churning out. We then think that less is more, and so in reaching beneficiaries, we should find out a few key beneficiaries and probably use these beneficiaries as multipliers of project outputs. We also think that for vulnerable groups, Star Ghana should revise their definition of vulnerable groups to include, particularly during this pandemic period, journalists, because we have about 3 of our regional stringers who are currently in isolation and are unable to deliver stories to us because they are on the forefront of this pandemic. And so I think they should form part of the vulnerable groups that there are. We also think that there should be a visibility component for the entire CRP project. And I think Safia has already started off with mentioning how we can make use of the media. We think that if we were able to amplify that much of what we are doing now through the media, it will be easier to get people on board to respond to us when we reach out to them. And so far, I think those are the opportunities and lessons we have gathered from our projects. That is it from my end, please.
Thank you so much, Precious, for a very exhaustive presentation. Very, very interesting presentation. Thank you so much for that. Now we'll have our colleague from the Ghana Federation of Disability Organizations. Please, Christopher, are you on the call and are you ready, please?
Hello, good afternoon. I hope I'm clear, please.
Yeah, clear. Please, Christopher, you have 10 minutes. Please go ahead.
10. Okay, I think I would be using less than that.
That's even fantastic. Thank you.
Just because I would even have to be leaving soon, but thank you. So from the Ghana Federation of Disability Organizations, we started this particular project in April. That is, and amongst many things, we were to actually improve on access to accurate, timely, and inclusive and relevant information on COVID-19, and also, to support communities and NGOs and other citizens groups to develop and implement initiatives at local and national levels for supporting persons. The Federation is a 9-member organization, but for this particular project, we focused on 5, which is the Ghana Blind Union, the Mental Health Society of Ghana, the Ghana National Association of the Deaf, Inclusion Ghana. Inclusion Ghana is an organization of persons with intellectual disability and shared neurological conditions. Now, with disabilities that were or has been dealt with throughout these 4 months, even in terms of communication, because I'll be getting to that in terms of the lessons that we've learned and all of that. There has been a lot with respect to communication, because ability is mentioned, a lot of food on, putting everything in one box, being in existence. That experience has been to technically deal with each individual organization differently. So for the activities we were to carry out, we had to develop and print and disseminate 10,000 COVID-19 information materials in accessible formats. Very important. So we had to engage the media houses across the country to air disability inclusive awareness programs, and also monitor government support programs for PWDs, and also developing and advocating the adoption of a COVID-19 response, the activities that we've carried out so far. Now, out of these, I want to highlight a lot more on the activities that, well, according to the plan, was not actually part, but we were able to deal with, or were able to engage on. One was, for COVID-19, one of the things that has, persons with disabilities, especially in access to health and employment, or access to, finances. So we were able to liaise with the National Board for Small Scale Industries. They actually came up with some support packages that were was done in collaboration with the government, but then
Christopher, you are breaking.
We were able to engage them to actually bring or include persons with disabilities in these. Okay, hello, can you hear me?
Yes, I can hear you, but
hello.
Yes,
hello.
I can hear you, yes.
Oh, can you hear me, please?
Yes, we can hear you. It was just breaking a bit.
Okay. 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 The internet connection is a bit of a challenge. Make it short so that it doesn't even bother. One of the major lessons we've learned to engage. Hello. So can you hear me, please? The internet connection.
Yes, it's breaking.
Is it okay now?
Yes, now, yes. But it's, yeah. Please go ahead.
Okay. Yes, I want to quickly conclude so that we wouldn't go through the challenge. But one of the major lessons that we've learned is the need to actually engage more with the stakeholders. It's very, very key, because if you look at the rush in which the government had to actually implement some support programs for the citizenry, and how persons with disabilities were neglected, even when they tried including persons with disability in the whole, a lot of things were not considered. For example, persons with disabilities accessing the 1 hot meal a day and then their dietary requirements, it was a big challenge. If you also look at even the locations where these actual interventions and response, when it has to do with persons with disability, access to information from the government sector. It was up until, the Federation engaged the Ministry of Information and the Office of the President was then protest on these platforms, so that the gap in communication and information reaching persons with disability was breached, was made possible. And so technology is a plus. It is also a bit of a challenge, because not all persons have access to technology. If you look at the other regions where even internet access is difficult, there are some sections or some parts of Accra that still don't have access to internet. It will surprise you. And so, in as much as technology was a very good way in accessing information and sharing information to persons with disabilities, it was also a big challenge, because not all persons with disabilities were able to, access this information. So what the Federation has been doing is that it has been using the district offices, as well as the member organizations and their representation across the country, to make sure that information reaches the each person with disability in a timely and accurate manner. So I think because of time, I would like to put it here. There's a lot I would have wanted to talk about, but because of time, I leave. Thank you.
Thank you so much, Christopher. We really, really appreciate that intervention. Very insightful. And I missed the challenges with the internet connectivity, your perseverance. Well, we really commend that, and apologies for that. It's such a big challenge when it comes to issues of connectivity. So just to go on to our next presentation, I just want to confirm, do we have a representative from the Christian Health Association of Ghana? Just to confirm that very quickly. Anyone from the Christian Health Association of Ghana? Okay, so I think we can move on to the presentation from WACSI, and I think that will be Nancy. Please, if you are ready to do that, please.
Hello, everyone.
Hello, Nancy. I think you have to click on the full screen, please.
Okay.
Thank you.
Yeah, please, can you all see my slide?
Yes,
okay.
Please.
Yes, please,
okay.
I can see.
Thank you, Charles, and thank you everyone for the opportunity. So for WACSI, we'll be taking you through what we've been doing, the results we've accomplished so far, our challenges, and some of the lessons and opportunities that we've been able to identify. So yes, this project started in April, and for WACSI, our primary role has been to continue to harvest, continue to document and share the various lessons and the activities of all partners' response actions to the COVID-19 pandemic. And we want to do this to be able to create a repository of information and documentation where other CSOs actors in Ghana and other countries can reference and learn from in our activities that has to do with responding to emergency crises and pandemics. So for WACSI, to be able to document, we are using 4 key strategies. We have the monthly reporting of response actions from partner organizations. We also have areas where we create the opportunities or platforms for organizations to share their learnings, to reflect on what the impact and the challenges that they've encountered so far. We are also engaging more with the media, and at the end, we will be producing a publication or a documentation to provide a more comprehensive view of the actions, the impact, and the various lessons this project has created so far. So for our monthly reporting, yes, the SIT rep, we started from May and we've documented till July. And we always capture partners' activities, and we also go beyond partners, the project partners, to give key highlights from what other CSOs in Ghana are also doing. And sometimes we also look at the West African region at large. And our documentation is creating a report or something that we can fall on, a reference point that CSOs can fall on to refer to what organizations, civil society sector has been doing in Ghana ever since the COVID-19 started. And we share it across all our social media platforms. We share it with partners, and they shared it on their websites and their Facebook. And we've received positive feedbacks from partners, other CSOs, and other actors alike on the activities and the impact civil society in Ghana are making. On our learning and reflection sessions, this particular meeting or this particular webinar is one of the key activities we are doing. That's the Partners Learning and Reflection meeting, where we are bringing on board all the partners to be able to share our actions, share our activities, reflect on our various lessons and identify some of the challenges we are encountering. Going beyond talking to ourselves, our civil society sector, we are planning to organize a multi-stakeholder webinar in 2 weeks' time. This one, we will bring on board actors from the government sector, relevant agencies from the government sector. We have the Ghana Health Association, the Ministry of Information, and other relevant government agencies. And the Ghana COVID-19 Private Sector Fund is also doing wonderfully in response to the COVID-19 pandemic so far. So we also get in touch with them. And yes, this project will bring on board all these key actors to share our lessons and reflect on areas of collaboration, areas of opportunities where all these actors can come together. And doing all this is really increasing our engagement with other stakeholders. And also as civil society sector, these learning sessions and reflection is enhancing the collaborative effort for us to work as partners in meeting a specific agenda. And we are also engaging more with the media. So with the media, we are looking at both the social media platforms and also the traditional media networks. So the social media networks, yes, our Facebook, our Twitter pages, our other websites, the e-directory platform, we are largely engaging all these networks. Aside that, WACSI is also using our platform, which is the 15 minutes in WACSI's platform on YouTube, to document and share the impact or the activities and impacts of this project to a more wider audience. We documented one with Safia in June, and we've received 159 views so far, which is very impressive. And we know that a lot of people and a lot more people will be able to connect to that and also get to learn about what this project has done and the impact we are creating. With the traditional media, last month on the 28th, we joined Star Ghana and the partners to organize a press conference. So for the press conference, we invited a number of media organizations to come on board to listen to what organizations are doing, what civil society is doing to respond to this pandemic. And since yesterday, we were featured in the on TV3 COVID-19 360 program. And this will be done throughout the period, throughout August. We will continue to share civil society's responses to COVID-19 on TV3, and the aim is that we want to increase our visibility to a more wider audience, to the general public, and also ensure that what we are doing doesn't just stay within our own coffers, but the whole general public will get to know the impact that we are creating so far. We've had a number of lessons throughout the implementation of this project. One of them is our engagement with the media. We've learned that doing this, engaging with the media, engaging with, especially with the traditional media platform, is actually increasing CSOs initiatives in Ghana around the COVID-19 pandemic. And also being able to document what we are doing and continue to share what we are doing with other networks, we are getting to understand the scope of work at hand. And we are also getting to know the impacts and the various challenges available that we need to harness on and we need to work at. And for our documentation of the monthly SITREP, we always try to collaborate with all partners. And doing that, we've learned that it has helped us to be able to capture the correct and accurate information that organizations are doing, and that has also helped to provide the impact that we are envisioning. We've had a number of challenges. One of them is that it's difficult to provide. We are having challenges to provide support to organizations to be able to integrate issues about learning and reflections in our everyday project life cycle. We've noticed that it's not really organizations don't take a conscious effort to include issues around learning, issues around reflections in our implementation of our project, and also, most importantly, issues around documentation of our activities. And another key challenge that we also encountering is that we notice that organizations are doing a lot important things in response to this COVID-19 pandemic, and we are supposed to capture all this and document all this information. However, there's also the issue around how to present all this information in a more concise and simple form, which is user-friendly for all actors, because the documentation will go beyond just the civil society sector, but also to the general public, to the government, to the private sector. So how we are able to compress all this information in a more concise has always been a challenge for us. But thinking around mitigation measures for these challenges, we are looking around something like providing training support to organization on the importance of integrating learning and knowledge production, documentation in our everyday project activities. And this particular webinar is a step ahead towards this challenge, where we are bringing on board, we have actually brought on board all organizations to communicate their results, to share learning, and also reflect on our activities. This project has created a number of opportunities, and I would like to share that we need to harness on all these opportunities as civil society sector. One of them is the opportunity for us to engage more with the traditional media. These projects have, in a way, opened the door to the traditional media network, the radio stations, the television networks, and the other media networks. So as civil society, it's important for us to engage more with the traditional media so that organizations will get to know us. We need to also connect more with other sectors aside the civil society sector. We need to connect more with the government and the private sector, and also the general public at large, so that we'll be able to showcase our activities and our impact. And this project has also created that opportunity for us, and we have to harness on that one. Also, this project has also helped the civil society sector in Ghana to be positioned in an area where we will be able to be recognized in the West African region at large on our responsiveness to COVID-19 pandemic in Ghana, and which is really good that we can harness on. And as individual organizations in our respective jurisdiction and in our respective area of work, this project has also created us the opportunity for us to show our relevance and our value as civil society sector in Ghana. So to conclude, yes, this project is really helping all organizations in the civil society sector to supporting us to respond to the pandemic, and through that we are doing a lot. So from WACSI's end, we will continue to admonish organizations to always document our activities, to always learn and reflect on what we are doing, and share our responses to a much wider audience, so that what we are doing, the visibility and the impact we are creating will be shared wider to a much audience, and also to improve our visibility. So thank you. This is what WACSI has been doing, and we are still doing, and we appreciate your time for listening. Charles, please, over to you.
Thank you so much, Nancy, for that very insightful presentation. Thank you so much. So at this point, I think it's time for us, if we have any questions or contributions. So we had presentations from our colleagues from the Ghana Federation of the Disability Organization, our colleagues from PEN+ Bytes, and our colleagues from WACSI, and some of the things that I got straight away from the three presentations. If I start with PEN+ Bytes, was the platform that they have created. I think we need to amplify that platform more. The information platform for citizens to give feedback, very important platform. COVID-19 info, gh.org. And I think they've put a lot of effort into it. and we need to help our colleagues and help. It also helped the work that we are doing to project this platform, to get that platform to be utilized by citizens. She shared a lot of challenges, but also shared a lot of inroads that they have made. And of course, the PWDs, the perennial problem of always being the PWDs being an afterthought. And Christopher was very clear about some of the government interventions that focused on citizens, but they did not really think through how they're going to support, especially the PWDs. And for me, I think that's a bit sad. And that it's sad that we are still not learning to integrate this very important part of our citizenry in the things that we do. So he shared very important challenges. And I think we can have a lot of discussions around that. And of course, my colleague also from WACSI emphasized on the importance of documentation, learning, and reflection, and the importance of the fact that we are doing this project in a coordinated manner. And all the information that we get and the data that we get from this project, we need to document it to help us become more effective moving forward, but also to guide us in terms of our emergency response during crisis like a pandemic like this. So I think very, very interesting presentation. So for those of us who want to ask questions, this is the time for questions. Can you please, there's a button for putting up your hand, or just drop in the chat if you want to ask questions. So the floor is open, please, or make contributions. And if you can be as concise and as brief as possible. Please, any questions, contributions from colleagues? Yes, Safia, please go ahead.
Thank you. WACSI, you mentioned, Nancy, you mentioned that you had very good feedback and reviews about the institutional reports that you have put out. I want to check, have you made efforts at directly sharing this with any state, apart from civil society? And then, Chris, DFGs, I want to check with you. You mentioned that, sorry, I think this is, sorry, I'll come back to you, Chris, later on. But for 10 plus bytes, my question is around the reach. Currently, you are around 200,000. The target for the project was in 1 million, if I remember right. We're talking within the million. So there's a huge shortfall there. What it implies is that the number of citizens we initially intended to benefit from this project are not really getting it the way we would have wanted it. Are there any other opportunities that we can try to reach out to them? Also about the fact that we are not able to take biodata of persons that visit the site apart from their sex. That's quite, it's not good news for me, because this project, like you mentioned, your target was persons with low levels of literacy, persons with disability. And so how are we sure that we are even reaching them if we do not know who actually is visiting? That's the concern. Please share with us what your thoughts are around dealing with it within the few weeks that we still have on the project. Thank you.
Thank you so much, Safia. Safia, could you quickly repeat the question you asked Nancy from WACSI? I think at that time it was a bit faint. Yes.
All right. Nancy, I asked how we have tried to get that very important document, the situational report, to reach some non-civil society actors, especially the state.
Okay, thank you very much.
Yeah, please go ahead, Nancy.
Okay, thank you very much, Safia. So for that effort, we are using more of the social media networks, where we are leveraging more on our Facebook platform and the Twitter pages, which bring on board a lot of other networks. But we also have conscious efforts to share more with other partners during our webinar upcoming to share it more with the government sector, since we have that opportunity to directly get engaged with them, share more with the sector and also the private sector as well.
Okay. I'm just really now thinking about this. Maybe, and it's not too late, we can also take advantage of other spaces to share with the state. For example, when we make copies of the report, maybe we could have been placing them directly within certain ministries and institutions.
Yes, Safi, I think no, I agree with you. I think that's
we think would be relevant.
you had finished speaking. Yeah, you kind of faded out. Please just go ahead and conclude. Sorry.
So I'm just saying that perhaps we could explore more opportunities to ensure that it goes beyond civil society. Some of them could be even delivering them to offices of key ministries and just placing them there. Yeah. Let's talk more about this as we push out the very last one. Thank you.
Thank you so much, Safia, for that very, very important point. Please, Precious, there were questions that Safia asked about the analytics and other aspects in terms of the reach of that very interesting platform that you and your colleagues at Pen Plus Bytes have developed. Would you like to give a response to those questions, please, Precious?
Yes, Charles, so I'll attempt to answer Safia's question. Safia, you'd agree with me that this question about PWD's segmentation on the site came up during your monitoring visit, and I tried to answer like I'm trying to answer now, that it is virtually not possible to tell that your user is a person with disability unless you give you put a restriction on your site that demands that users register. And so when you open the site, the first point of call is you tell us who you are, whether you're a male or female or a young person, or whether you're a person with disability. And we thought that for an informative site like this, it will be a barrier for people to visit your site if you put such a restriction on it. So the site is able to tell us that there were so and so, the analytics from the site is able to tell us that there were so and so number of persons who visited it. There are this number of males within this age range and from these countries, but it's unable to tell us persons with disability. Now, I need to correct you on the fact that you mentioned we mentioned that the site is going to reach 1 million Ghanaians. No, we said that our project beneficiaries are 1,460,000 Ghanaians. So it means all the activities we are doing around this project is supposed to reach this many Ghanaians. And so to say that for the platform to have reached 200,000 persons in a month is quite a feat for us, because you don't usually get people visiting sites due to technological challenges, internet connectivity issues, data credits that people cannot afford, and all these issues that Ghanaians are faced with when they try to use tech tools. And so, yes, we are segmenting the other activities we are doing around this project with that thought in mind, as we know that we need to report on a monthly basis how many PWDs we reach, how many women, how many girls, how many. So this is in mind. But for the platform to do this particular thing, we think it's a no-go area for now. If Star Ghana still insists that we do so, we would have to put in the restrictive measures where you would have to register or tell us who you are before you use the site. That can be done. So I think I have tried to answer Safia in that line. We can also do subscription to the site, but well, we think the restrictions, when they become too many, people are just put off by those. So we would want to make it an open site for now, but if Star Ghana wants otherwise, we can still do what Star Ghana wants us to do. Yes, please.
Thank you, Precious.
just a second, Precious, let's discuss this. It's not, I'm not sure it's what Star Ghana wants to be done. It's more of what gives the best value for the project in terms of outcomes and benefits to citizens. So we can discuss after this. Okay.
Sure.
Thank you.
Sure, we can. Thank you.
Yeah. Yes. Thank you, Safia, for that. I was about to say almost the same thing. Thank you for that. I think we're trying to get the best out of each project, and I think we should do it. And I love what you said, Precious, in terms of from a technological point of view, in terms of access. You've raised a lot of very important issues. So thank you so much for that. Any other, do colleagues want to ask any other questions or contributions at this point?
Yes, Charles?
Sure, go ahead, please, Safia.
Okay.
I didn't see your hand.
Of a reflection, I know the kind of coordination and collaboration that has happened between and among partners on this project, and on many levels it's been really, really good. But I have to say that there are still opportunities I think we haven't explored enough yet. In the discussions, a few came up, but also because of the opportunities we've missed, you know, there was a lot of silence on some of those levels of collaboration. I just want to highlight that there's a lot of benefit to it. For example, for Media Foundation for West Africa, I think I'm overflogging it, but I've said it a few times that to have access to 50 media houses across Ghana, you may be in Accra, but you have opportunity to be able to reach citizens all over Ghana through these platforms. I don't think we have made very good use of them. So maybe just making the inputs that there are opportunities we should take advantage of. Yeah, also then the thing about working with SAP partners, the project was on two levels. For each team and objective, there was a lead partner, you know, for information dissemination. And for all of the 4 objectives, we had partners that were leading and others that were supporting. But we also had sub-partners. The sub-partners were mostly non-civil society organization actors, or even if they were CS actors, they were not within this project. So NCC and other state institutions. I just want to remind us that we made some commitments to work with some of them at some levels. So as we discussed, it would be nice to have been bringing them out, the efforts we have made to engage with these actors. Not if we have missed opportunity during this discussion, I want to encourage that in the report that comes next, if you haven't put it in yet, please share how you have worked with actors outside of this partnership. It would really be helpful. Thank you.
Thank you so much, Safia. So originally at this time, we were to have a quick snippet in terms of a quick learning on how we can communicate our communicate results. I just want to ask the whole group, are you comfortable with us going on for just over 10 to 15 minutes just to conclude on that? Or if we are tired, it will be okay, we can still share the PowerPoint and we conclude here. So I just want to see in the chat room how people are feeling. So can we go on? Is the silence means can we go on? Or we are tired? Okay,
Mine means yes.
Kojo says we can go on. Okay, well, let me behave like a dictatorial democrat and interpret what the silence means. So please, Jim, if you can quickly help us through that presentation, which I think is actually a very important one, how we can communicate our results effectively. So Jim is just going to share some major highlights. So Jim, please go ahead.
Okay, thank you very much, Charles. And thank you, colleagues, for the patience and openness to take this aspect of the session for today. I want to share my slides. Let me see. Please, if you can see my screen, kindly let me know. Can you see my screen, please?
Yes, we can see your screen.
Yes, we can see.
Yes, you haven't clicked. You haven't clicked on it to fully.
Lovely.
Yes, but it's
lovely.
there.
All right. Thank you very much. And what I'll do, given the time constraint, I will not go through every content as elaborately as we had envisaged, but we'll just look at some key overall elements that are quite key for us at this stage. And in reflecting around this, the important factor, and to build to what Safia just said, that how can we take advantage of the potential that exists in this cohort of civil society organizations to scale up our work. And that was actually one of the bases that we took into account when reflecting through this, and also to acknowledge that really many of us are doing well in terms of communicating what we are doing, and there is always room for improvement. So we appreciate that. So this is going to be like a refresher. We'll try to make it to be a discussion so that we can interject or share perspectives at specific points in time. And I'll be stopping just to get us to have those discussions as and when they emerge. Basically, just talking about the update. But in terms of, just to lay down the foundation, looking at communication generally, it's important that we appreciate that we should tackle communication from the sharing perspective. Over the past, sometimes when we discuss with other colleagues about what communication is all about, some would say it is sending information, from the organization to beneficiaries, from the organization to donors, which is not all that bad, but it is an element of what communication in its totality is all about. And to have communication to be fully addressed, it's good to look at it from the perspective of sharing. And by sharing means there is a kind of give and take. There is a kind of bounce back response that you get after you've sent your information. I prefer often to use share the piece of information that we are using. And in this case, it can be by individuals, it can be by organizations, it can be by individuals within organizations, and in some of our organizations or within the entire civil society sector, there are some organizations that are doing exceedingly well, as well as their staff, in terms of communicating on the issues, the results that they are working around. There are other organizations where you see that there are individuals within those organizations whose communication outweighs or outshines the institutional communication. So it's just important for us to have that in mind, because we are going to be talking about influencers that we can capitalize on, and that is where we are going to see where to pick either the organization or the individuals who are communicating excellence in their or within their organizations, or on the issues that their organizations are working to address. And so this is actually going to be the focus of the session. Basically, for us to communicate our results effectively, there are some key things we need to take into consideration. And there are actually 6 enumerated here. First of all, it is about why are we sharing the results of our work? And please, I would just like to call names randomly because we really wish to make this a little bit interactive. So At this point, permit me, Kojo, maybe I should begin with you. From the work that the SDG platform is doing, why is it important to share the results of our work with the larger audience? Kojo, can you hear me, please? Are you okay to give it a shot?
Yes, I can hear you. I think specifically to us, because of our numbers and because of the diversity of our membership, it's important to share results to keep people engaged so that at every point they know what is going on. And it also helps to create a buy-in. Civil society organizations would only give you the support if there is some level and there's some level of buy-in. And so I think the sharing of results kind of brings it to a full circle.
Thank you very much, Kojo, and those are quite spot-on responses that you've shared. And the key thing that we will take from this is basically that these responses are the responses from the SDGs platform as they appreciate their work, as they appreciate their context, based on the kind of stakeholders, immediate stakeholders, secondary stakeholders they are dealing with. And I really like the fact that you brought in the buy-in, because for the network to be strong, it requires its members to hold on to the vision, to support what the network, the umbrella network is doing. And to do that, you need to share the results with them, to keep them engaged, to get them to buy into our work. So in our respective spheres as organizations, it is important that for every result that we are able to identify, we should critique, do a self-critique, do a self-appraisal as to why is it important at a point in time to share that result. And that will help us, to define why, the rationale, the objective for which we want to share that result. And for example, like we just said, it can be to get the buy-in of members of the network, to keep the members of the network engaged in the activities of the network. And so it's important for Caritas Ghana, for WACSI, for Star Ghana to define these objectives clearly and have them somewhere, so that as we continue to communicate our results, we should peg the results of our communication to the objectives we set from the very onset. The next element, once we've defined why we are sharing the results, or we have to share the results of our work, we have to move on to articulate what we are sharing. And here, generally speaking, it is the message behind, or the foundation, the pillar, the substance of our communication. Within the context of this discussion, within the context of this project, we are looking at the results. And it is quite critical because we are in the last few weeks of the project. So as much as possible, it is important for us to tilt our communication fairly or appreciably towards knowing the results and capturing the results that we want to share. And once we capture the result, the packaging is quite key. And with packaging here, looking at the work that Pen Plus Bytes is doing, Ghana Federation for Disability Organizations is doing, and I'm sure the SDGs platform, we have some of our stakeholders who have unique characteristics that we have to appreciate. Maybe they have visual impairments, maybe they have limb deficiencies and stuff like that. How do we package that information in a way that will be appropriate, will be suitable for this particular audience? And that takes us into the next bit, is who are we sharing our work with? And just to share that we are going to receive these slides, and we are going to really see the sub elements under each of these. But the key thing with regard to whom we are sharing our information with is generally it's our audience, it's the stakeholders, it's the beneficiaries. But it is very important that as organizations, we should be able to say, for these results that we have been able to document. Let me take the case of Caritas Ghana. I think he shared a very important question. I think he shared the question with Safia, asking how Star Ghana can facilitate linkages with that will help in terms of advocacy or policy advocacy. With using or utilizing the results that we are getting on the field, we can package our messages in a way that will help us to trigger advocacy discussions or actions or general advocacy, public advocacy, you know, in the audience that will receive the message. And if you take the case of the results that Zan presented, he shared results as to how many more people are using face masks, many more people are respecting social distancing, and I think if I got one of them correctly, is around the reduction in gender-based violence. I hope I captured that correctly. If we can produce the statistics around that, and how many persons were subduing or were victims of gender-based violence in a particular community prior to the engagement of Caritas Ghana. 3 weeks after their engagement in that community and sensitization and education, what is the current rate today? What are the opportunities for action by the civil society, by governments, by different stakeholders? If we can have these statistics and share that statistics with the, here I will use levers or the influencers, someone like Franklin Kujo, who likes using figures to inform or alert policymakers on key challenges within our society, for example. If we can package that information and know that for these results that we've gotten after 3 weeks in a particular community, we want the change to continue. We want to build on the gains that we've made so far. So we are sharing this specific information with Franklin Kujo, for example. We are sharing this specific information with Star Ghana, for example. We are sharing this information with My Joy Online. You know, being specific about the target audience helps us to best articulate our results to the right audience and in the way that will be appealing to that audience. Why am I mentioning specific names? Star Ghana, Franklin Kujo, My Joy Online. The key thing for us to note here is that all of these 3 examples I have cited fall within general categories. Star Ghana is within the donor community. My Joy Online is within the media community. Franklin Kujo is within the civil society community. But it is important to know that Star Ghana's interest as a donor may be different from the interest of another donor operating in Ghana, like the US Embassy. And so it is important to cite or identify all our different stakeholders, mention them by name, appreciate their key interests, such that when we have harvested the results that we have, we can best package these results or articulate our message in a way that will be interesting for the specific stakeholder that we have identified. And that will then help us to move on to how we are sharing the information. So what tools, what channels are most appropriate or most suitable to convey our message, to convey our results to the specific donor or the specific stakeholder we have identified. And that again is where the unique characteristics of different stakeholders is quite important, and their interests as well is equally quite important. I remember one of our partner organizations made mention of literate, or is it semi-literate and illiterate. what are the peculiar needs of these different groups. It's important to appreciate them and use the understanding of the peculiarities of these stakeholders to inform how we package our message, to inform the kinds of tools that we use to share our messages or our results with these different stakeholders. And the next thing we need to take into consideration is the element of timing. When are we sharing the results? Usually within the project scope or project timeline like this, we can pick the results sharing as an activity midterm or post or towards the end of the project. But in an interesting context like Ghana, particularly at this time when there are a lot of highlights in our society, there is elections, campaigning, outdooring of the vice or the mate, the running mate of the NDC, the vice president talked about the budget, borders were short and stuff like that. The president comes out to make speeches and talks about PPEs and so on and so forth. It is sometimes important to look at what we are doing, the results we are achieving, and peg them to certain highlights in society. And I think Media Foundation is a key example that is really leveraging on this opportunity because their fact-checking is quite spot on. You know, when some of the political activists or parliamentarians or members in government release specific information that are incorrect, they come out to capture the false information and provide the corrected or the correct perspective of that. And that timely intervention, that timely response is quite key because the level of interest that the audience or potential audience or target audience is likely to have is high. So it is important for us as we are doing our work to be very alert and sensitive towards the key events in our society and how we can liaise the results we are achieving to the highlights in our society to win increased interest, increased attention to the information we are sharing. The key element that we have now is talking about the response we are receiving from recipients, from the audience or the feedback that we are getting from different stakeholders. And that is quite key. And I think Safia has raised that. I think she shared about 2 or 3 observations when we were presenting that tells you from a donor perspective how interesting or interested they are in knowing what others are saying about what we are doing. And it can be challenging if we as partners, we are not conscious of that in the project implementation process, in the communication cycle as we implement our projects, because we can miss out on those critical feedbacks that are coming in. And I think Pen Plus Byte is doing that quite well. I think you use the technical term iteration, on the go iteration. You know, where you are getting feedback from the users of the platform, and that is informing the modeling or the adaptation of the platform to respond to the needs of current users or potential users. And you can see that in the case of Pen Plus Byte, it's helping them to make this platform or these tools that they are keeping at the disposal of Ghanaians to be most suitable, most relevant to us, the users and potential users. And that is an advantage that listening to our audience, gathering the feedback and using that feedback to enhance our work can help us to really achieve significant milestones or gains in what we are doing. So the subsequent slides actually elaborate more on all of this, and we are going to share with you. One key thing that we would just like to talk about is the element of, you know, some opportunities within this network of CSOs or consortium of CSOs that we have is that within our spheres, You know, there are different organizations or entities. Let me use that word. There are different entities, and these could be organizations, this could be partners, this could be individuals whom we can capitalize on. Already we are acknowledging the key strategic positioning of Media Foundation for West Africa that can relay us to 50 other media houses across the country. You know, these are influencers. You know, amongst our network, there are equally other organizations that have a high social media presence, like Pen Plus Bytes, for example, Star Ghana, Caritas Ghana, you know, and within our organizations, there are certain individuals who are high, who we can consider as influencers. And if you take Caritas Ghana, for example, Zan's online presence as an individual, he is very, very engaged. And the interesting thing with Zan, for example, is that he brings to the fore the key issues that Caritas is working to address. It is not obligatory for staff to do that, but when some staff take that particular interest to do that passionately, it is good to identify them or map them out as the influencers we can work on. Within the civil society space in Ghana, I can make mention of, I know of Teko Saba, she's active especially on Twitter. I know of Charles Van Dyke, I know of Franklin Kujo. I think within CDD, there is Prempe, you know, then there is Zan and Suleimana Brahima. These are just a few. And then there is George Bimpe. These are just the few that I know. You may know more of them. The key thing is it is important to identify these influencers within our society. Once we identify the influencers within our society, it is good to do some kind of thorough analysis of these influencers. What are they interested in? It is important to know. George's interest, George Bimpe of Sengana, he's quite keen on accountability, and he's really not happy with the way successive governments are, you know, posting Ghanaians with poor governance, you know, as I can generalize it. You know, Suleimana Brahima is quite keen on giving the media their space, but beyond that, ensuring that accurate information is churned out in Ghana and across West Africa. These are just examples. For the influencers that we know, what are their interests? It is important to map out these interests, see those of these influencers that align with your interest as WACSI, that align with your interest as SDGs, CSO SDGs platform, align with your interest as Pen Plus Byte, and then you can reach out to them. And reaching out to them it can be issue-based. So in our implementation, as we are carrying out our project, if we find out that there are issues of poor distribution of food, I think our colleague of Ghana Federation of Disability Organizations, he raised it, where the distribution of food does not meet the requirements of persons with disabilities who are already challenged in accessing the free food during the lockdown period. If you pick out an issue like that and send an email to George Bimpe to alert him on this injustice in our society perpetrated by the government, you will see that he can take the message to another level and bring it to the fore. And so it's important that once we know these different influencers, we should identify how to reach out to them. Is it by email? Is it by phone call? Is it through a Facebook tagging? Is it through a face-to-face meeting? Is it through a WhatsApp chat? Maybe you are with them on the same WhatsApp platform or in an email listserv that you can use to share the message with them. It is important to know how to reach out to them to highlight the issue that you are interested in. Then the next thing is timing again. When should you reach out to them? And the key thing is, once you've identified these influencers, it is good to appreciate their, permit me use online behavior, because I've used the case of most influencers who are active online. So it's good to observe their online behavior and see, for example, when they normally post. how they post and see if commenting on their post is the best way or what is the best time to reach out to them. You can be able to gain that, from that observation or by reaching out to them on a call. And then you should also know what to share with them. Is it just going to share anything on Facebook, or is to send a report of your activity with them, or it is to share a policy brief with them? It is up to you to know what to share with them, and one way of knowing what is best to share with them is actually by contacting them through an email, through a phone call, to discuss your interest or your wish to collaborate with them in highlighting some of these issues or the results we are seeing in the field as we implement our work, and they will advise on the best way to reach out to them for them to take that issue forward. So these are just some tips that we can use, to strengthen our collaboration, especially as we will be communicating results during this period, or as we communicate results. It's important for us as partners to endeavor to find other partners online. So Star Ghana, for example, is on Facebook. Star Ghana is on Twitter. Pen Plus Byte is on Facebook. Pen Plus Byte is on Twitter. I don't use Instagram, for example, but maybe Pen Plus Byte is on Instagram. And so if you are on these different platforms, it is important to find these. We should find one another, really as individuals first. Follow our partner organizations, the SDG CSO platform. We should follow ourselves on Facebook, on Twitter, and we should do the same for all the other partners. Then, once we follow one another, it is important to tag. So when we are putting a post that relates to this project, for example, or a post that we know that WACSI could be interested, Star Ghana could be interested, it is important to tag these partners so that there will be this online alert, online notification that will be generated by the platform we are tagging one another on. We should also take some time to comment. It can be challenging to comment on the platforms of all 8 partners, but periodically, once in a while, we should comment about what the other partner is doing. If you participated in an event organized by SDG CSO platform, what's your impression about that? What has our organization learned about that? What can you write or feature about that activity online such that it should boost citizens' knowledge on what is going on through your platform? It is important for us to dedicate some time to see how best we can do this, because that is some form of virtual collaboration, which is important. It may not be noticed by the organization you are collaborating with in the immediate, but certainly it has some gains on our project. Another thing we can do is just by sharing the post. Sharing is the easiest thing to do on Facebook, on Twitter, on LinkedIn, on Instagram. If we are on these platforms and we see a piece of information that a partner organization has shared, it is important to share that post so that they can gain more visibility on our work. And remember, the achievement that the Media Foundation is gaining through its contribution to this project is something that we are collectively benefiting from. So we should endeavor to give a hand, yes, to give a hand to colleagues, to partners as we are communicating together during this process. And another thing is also to give feedback. Have you stumbled upon a piece of information that has been shared by one partner or the other? A like, an emoji, a smiling emoji, a congratulatory remark, a thank you emoji is something that, it has a way of replicating or creating a positive ripple effect online in terms of visibility and communication. But again, it gives a positive feeling to the organization for doing that work and for sharing that piece of information. At this point, dear colleagues, sorry, I've just been, well, it's been mainly one way, but I'm opening the floor now, and it's basically to open up for us to have a quick discussion. We can take 2 or 3 remarks, and the key thing is, what appeal, you know, from the work that we've been doing and how we have been doing enormously, putting in enormous efforts to communicate on our work, and we want to do more within the scope of this project and beyond with the current partners that we have now. What appeal or what recommendation do we have for partners to support you or support us to effectively communicate the results of our work during this period? And we are going to use 2 approaches to address this. We will take a couple of hands, but if you have a suggestion, you can type it in the chat section, and that will be captured in the report. So kindly show by a raise, kindly raise your hand, and we can take a couple of contributions, please. And if you have any questions or you have any remarks with what might have been omitted or what you think is important for us to touch on, feel free to share at this point. But the key thing we are looking at is what recommendations do we have for project partners here present to help us with or in supporting our communications as we move forward. The floor is open, please. I don't know, is there any hand that has been raised? Okay, no hand has been raised. Any chats? Has any chat come in? No chat has come in. All right, so on that note, colleagues, I'll leave it here, but we will be sharing the slides with us, and if we have any questions, any perspectives to share, we have the WhatsApp platform that we are discussing on. We can share our observations there, and we can continue the discussions there. Thank you very much, colleagues. Thank you very much, Mr. Moderator. Charles, you have the floor. Thank you.
Thank you so much, Jim. Thank you so much, colleagues. I just want to invite Safia just to give us a quick word as we've come to the end of this learning and reflection session. So Safia, a quick word from Star Ghana.
Thank you, Charles and Jim, for taking us through this session. It's our first, and I think the time has been really spent swiftly. I have heard many new things that going through the report.
Apologies, Safia, we can't hear you. Sorry.
Okay, I was just thanking you, Charles, and Jim for bringing us together this morning. There's a lot I have taken, new stuff, even though I've read all the reports. When we speak this way, there's always something more to take. So this has been really useful to me. Maybe I'm the biggest beneficiary of this session. So it's just to encourage us around the coordination thing. We've spoken about it, please. I think that there's so much more we can do together. I'm always just a call away. If there's something or a partner you wish to work more with, please, you can get in touch with me if there are any difficulties you are facing. And so far, I find that all partners have been really open to partnership on this project. So please, let's get the best out of it. We have a few weeks to go. For some of us, there are still a lot of activities outstanding. And we are open to have discussions on how we can navigate the difficulties that we may be facing, so that by the end of August, when we conclude this phase of the project, we will all be very proud of what we have delivered. And I want to remind us also that our reports are due by Friday. Please, I'm looking forward to it, to do a compilation. The third one I want to talk about is that DFID is requiring of us, and that links to data. DFID is requiring of us to do a monthly reporting on activity indicators. So there's a set of activity in every performance plan, and every month we are required to report the progress on each activity. How far have we come to meeting the indicators we set? I've put together a spreadsheet. I have been responding to them. And so please, I just want to encourage that to be able to do that, I take it from your report. So please feed us with as much data as possible for us to be able to do this. We are always so on. The media drive continues. Next week we are continuing, and the schedule has been shared. I want to encourage all of us to make time to participate when we are doing, and let's get the best going for all of us. So thank you so much from Star Ghana, from people who couldn't make it, and please let's keep our good work going.
Thank you so much, Safia. Thank you so much. Just want to commend all the partners who have worked so relentlessly in this project so far. We've seen all the good work that is being done, and it's amazing the work that's been done. It's always so lovely reading and hearing from colleagues and the work that you're doing. And thank you so much for the work you're doing for God and for country. And yes, Kojo also from SDG platform has raised an important thing, maybe Safia and all of us can reflect on. He's saying, is it possible to have a centralized social media campaign with what has been achieved this far? So maybe this is something we can all think about. Maybe Safia is something that Star Ghana. So he's saying, can we have a centralized, a planned social media campaign that's basically going to showcase what has achieved this far? So that's Kojo Owusu from SDG. But I want to end by saying a special thank you to Star Ghana Foundation and Safia, who has been the point person for your energy and your relentless efforts in driving this process. It's quite a challenge working and coordinating different institutions and organizations. So we are really thankful for the good work that you're doing, the energy and the drive. And just to say, in 2 weeks' time, we are hoping, it's not yet confirmed, but we are hoping to organize a multi-stakeholder convening where we bring both the private sector and the government. And of course, this invitation and details about it will be shared as we are able to put things together in the coming week. So thank you so much for attending. And I want to thank my colleagues from WACSI, from our communications team, my colleague Jim, Nancy, and all other colleagues, Marilyn, Lisa, and others who have been on the call. Thank you so much for the support. So wish you all a lovely day. Right, goodbye.
Goodbye.
Bye.
Goodbye.
Goodbye. Okay, thank you everyone. Bye.
Bye.